health. And then once we finish our health issues or topics, then we're gonna go to the housing part. So one of the goals here that we have in the health committee is to educate our community. And as you know, right now there is an issue affecting not only our community, our state, our nation, our world. And you know, everybody knows it's COVID-19. And besides all the infections and community spreading that is happening right now we can begin to see the light at the end of the tunnel. Before we start and I introduce my guest, I just want to give you some, as you may know, a new strain of the virus was found in UK, and that strain was found here in New York already. So, and it was found in a person who hasn't traveled. So therefore, we already seeing community spreading here in New York. And the difference between this current strain and the regular virus, and that this one is more contagious. So right now we have more challenges that we're going to be facing. According with the governor, and this is, we have to see, when we talk about COVID, we have to see the big picture and the small picture. And the big picture is how we're doing in the state. And according with the governor, yesterday, hospitalization rose to 8,251. In terms of testing, there were tested 134,360 people, and out of those, 8.34 positive, or 11,209, if you want to know the number. There were 1,357 patients in ICU, and this was up from the previous day by 13. Those 843 are intubated. And we lost 170 New Yorkers with the virus. So when that was the big picture, I just wanted to now tell you about the small picture. And when we talk about the small picture, we're going to talk about community. And when we talk about the community and Community Board 2, we have to say that Community Board 2 falls within two zip codes, is 10474 and 10459. And when we see the positive rate in the last 7 days in the 10474, that's the Hunter Point part of the Bronx, is 15.87%. So it's almost 16% of positive rate. And for 10459, which is the other side of the Bruckner, where Urban is located, is 14.10% of positive rate. And this happened in the last 7 days. So with these numbers, and according with the way that the DOH and the state has it together, we fall into what is called the yellow zone. And although you can get more information about the yellow zone, I can tell you that in terms of some basic information, it's like for house of worship, only 50% capacity are allowed. In terms of gathering, no more than 25 people. And businesses, they will remain open, but they have to follow the guidelines that are established for COVID. Dining, when we call dining, we call restaurants, bar, cafes, or other services, is only takeout or delivery. And for schools, they have to follow what the school guidelines they have. So this is basically fact information that I just want to bring to you before we bring our guest. So our presenter, his name is Dr. Vitu Jacob. He's currently part of the COVID testing and vaccine task force at Urban Health Plan. We believe he's the right person to come to talk to us about, and educate us about what's happening and where we're going. He will talk about COVID, but more than anything about the vaccine. There's the new hope. Come back to that, what we're going to call it a new normal. Some of the questions that he will answer is...
Louis, I'm sorry. Ralph,
Yeah.
Can you mute everyone, Ralph?
I learned to regret that when I said that back in November. Doing it again. Let's see if this one goes a little quicker. Okay, so we have the first wave of our exit polls. So I want to say before I show these numbers, looks like in Georgia for this runoff. So let's see if through a couple of different things we can see. First of all, the composition, leading in this first wave of exit polling, the composition of the
Louis, you on mute.
race, obviously, you see a lot of big divide there politically in Georgia.
Mute myself. Can you hear me now? Yeah. So some of the questions that he's going to answer is, do vaccine work? The side effects? When can I get it? Where should the vaccine? If I've already had COVID, should I get vaccinated? When I get vaccinated, can I stop physical distancing, wearing face masks, or covering? So also some of the topics and questions that we're going to that Dr. Viju is going to have. He's going to have a presentation to us. If you have any questions, please let's wait until the end when he's finished, so we can have this conversation amongst everybody. So let's welcome Dr. Viju Jacob.
So much, Louis. Louis, should I pull up my presentation or you guys have it?
Oh, I think Rob.
I have it. I'm sorry, doctor. I do have it. Bear with me.
No worries.
There it is, right here. Just let me know and I'll go through it.
Perfect. Thank you. So happy New Year to everybody. So, almost like the Hair Club for Men commercial, I'm not just preaching the thing. So I was lucky enough to get my COVID vaccine this morning. My wife also works in healthcare, so she actually works out of a hospital. So she got hers 3 weeks ago. So this Friday, she'll be getting her second dose. So a lot of this is first-hand information, along with obviously the science that's out there. So my name is Viju Jacob. I'm a pediatrician by trade, but I currently work at Urban Health Plan in the administrative functions. I've been practicing in Hunts Point and the South Bronx for the last 18 years. So intricately familiar with our two zip codes that Community Board 2 represents. Next slide, please. So, what are some of the, I wanted to sort of put it up front, what are some of the reasons, why did I choose to get vaccinated, right? So obviously the obvious things, I want to protect myself, I want to protect my family, but just as importantly, I want to prevent the spread in the community, and I want to set an example for others, and I sort of really ask everyone, so all of us have influence on somebody. So, whether it's our family members, our friends, our social groups. So, I think the more of us that understand the logistics of this and the information that's out there, the information that is from trusted sources, the more we can share that with others, the better it's going to be. So, I think that's what I want to get out of this presentation for everybody. Next slide, please. So the million-dollar question everyone wants to know right up front is, are the vaccines safe, right? And the big question that everyone sort of worries about is, it's been rushed through, right? So, we haven't had enough time to go through all of this stuff. It's barely been a year. How do you really know all of this stuff is true and stuff, right? So let me just set some groundwork for, why it wasn't rushed through and why it's gone through all the proper channels and stuff. So everyone sort of, mRNA vaccines, it's new to the public, but it's been researched for the last 30 plus years, both for vaccine purposes and for purposes along in cancer research. So the underlying technology behind how mRNAs can be used for other purposes have been studied for almost 30 years and stuff. But the big difference is typically when a company is developing a new product, a new medication, a new vaccine, they have to put up the money up front, right? So they have to sort of, look at multiple different people that are working on something, see which ideas is going to work, fund those ideas, and if it seems like it's getting better, then they fund it a little bit more and so forth and so forth. What was different about this time around is the U.S. government and governments around the world literally put out billions of dollars up front, right? So they said, here's the money, figure something out because the whole world has come to a standstill, right? So the cost part that many companies sort of hold them back in sort of advancing through research quickly was taken away by the fact that many governments put up the money up front, right? All of the vaccines, so the ones that have already been released and the ones that soon we hope are going to be released, have gone through all of the steps. So, you hear about these things called phase 1, phase 2, right? So those are like, phase 1 is almost like, I came up with an idea, I'm testing it on like a small population. Phase 2, I sort of, I'm doing some animal models or models on computers. Phase 3, I recruit people that are interested in joining vaccine trials. And I try to get a nice spread of people. And a typical vaccine trial, in a good year, a typical vaccine trial gets about 3,000 people enrolled in it, right? And I'll show you some numbers. These vaccine trials, both of them independently, have had well over 30,000 people participating in the vaccine trials, right? So it's exponentially more people have received the vaccine as part of the trial to get us some of the information, right? Does that give us all the information? No, right? That's why there's what's known as a phase 4. So after you've sort of figured out that it's safe in animals, figured out it's safe in computer models, figured out it's safe in human beings, then you sort of release it to the general public, right? But while you release it to the general public, you're still monitoring for side effects. And I'll sort of talk about how the government and important agencies and the companies that have developed the vaccines are keeping track of these things, right? So those are those phase 4 trials after things have been released. And in many times, you can't see the small effects until you've given something to a lot of people, right? So, even though 30,000, 60,000 is a good number and a spectacular number, when you give it to millions of people, that's when you may notice, there's this 1 out of a million, that's where these phrases come from, right? So 1 out of a million person that sort of came up with some sort of reaction that none of us expected, and how common is it, and so forth, right? So in addition to, all of the companies following through all of the steps that they had to do, there are 2 independent agencies that have also looked at the data that the companies put up, right? So it's not just the companies plus a bunch of data and everyone says, great, let's run with it, right? So an independent agency called the Food and Drug Administration, and then a separate agency in the CDC known as the Advisory Committee on Immunization Practices have both looked at it, right? So then everyone goes, but those are just government rubber stamps, right? They're just stamping on, what the government wants to do and stuff. But within these 2 institutions, there are advisory boards, and the advisory boards typically have national experts on the topic, right? So whether it's a disease, a medication, or a vaccine, there are national experts who are independent. They don't work for the government. They have regular daytime jobs. They take it upon themselves to volunteer to sit on these committees so they can review data and make sure it's safe before it makes it out to the regular public, right? So I'm sure many of us, as we watch different channels, you sort of see these different experts come from, prestigious universities and colleges who are sort of talking about their own review of the data. And that's the biggest sort of safety check that there is, that no one is, sort of being able to push anything through, right? I always sort of, when I talk to my patients, I always say, people much smarter than me have looked at this, have analyzed it, presented the data so that the rest of us can look at it and make our judgment on it and stuff, right? So I want to reassure everyone that independent bodies have looked at the data that the companies have put out. They've made a determination who is it safe to give to and what do we know about it before we have been authorized to use these vaccines. Next slide, please. So as I was saying, so right now the 2 vaccines that are authorized currently in the United States are the Pfizer vaccine and the Moderna vaccine. And if you look at it, both of them had like I gave you a benchmark of about 3,000 people in a vaccine trial is considered a good trial, right? So, the Pfizer trial had almost 40,000 people and growing. And so these are the numbers at the time that the data was submitted to the CDC and the FDA for review. And the Moderna trial had almost 25,000 people. And the other big question is about social justice and equity, right? So are these only people who have, access, who are richer, who are whiter, who are, whatever? Are these only done in special populations? And, how can we interpret that data for other populations? And as you look at the data, it was a very racially diverse population that both of these studies were able to enroll. In the Pfizer trial, 10% were Black, 13% were Hispanic. In the Moderna trial, 10% were Black, 20% were Hispanic or Latino. So, there's a nice spread of racial diversity. There's a nice spread, as you notice, in age. So, looking at the highest risk population, right? So the 65 and above tends to be what we think of as the highest risk population. So there's a nice spread of people in those populations as well. Next slide, please. So both of these use a technology called mRNA, like I talked about. mRNA is new to the vaccine world, but it is not new to, my son's coming home, so the dog is excited for him. So, mRNA is new for, a use in a vaccine, but it's technology that's been studied for quite a long time. And the easiest way to sort of explain what mRNA does is it's basically just a message. That little M in front of RNA is just a message, right? It's sending a message to our body to make our own antibodies, right? So there's nothing coming from the outside. It's just telling they're putting a little piece of the COVID spike protein in there to let our body know this is what you need to make antibodies against. And, the spike protein is, we're all used to seeing, like, as soon as the news comes on, right, they put that big ball and the little red spikes. Those spikes that come out of it is what's the spike protein, right? So that's what attaches to our body and causes our body to sort of, have an infection and stuff. So what this messenger RNA is doing is sending a message saying, I want you to make these things that can block those spike proteins, right? So the antibodies are your body's defense system that come and sort of sit on top of the spike protein so the spike protein can't attach to the rest of our body and cause infections, right? So our own body is asking us to, is challenged to make this immune response, right? The messenger RNA pretty quickly dies off, right? So they actually have to coat this messenger RNA in this material called PEG, which is polyethylene glycol. And if anyone's ever had a colonoscopy, that's the stuff that they make you drink before you have a colonoscopy so that, you can clean up your bowels. But it also helps to coat the particular mRNA so it can last long enough in your body so that this message can happen, and then it dies off pretty quickly. So the mRNA is not sitting in your body, not staying there. It's dying off. It's being held together just long enough to get this message into your body, and then your own body's immune system is doing the rest of the work, right? It does not enter the nucleus of our body. It can't affect the DNA of our body. So, there are lots of people, are afraid that, I'm going to have a third eye and I'm going to turn green and become a mutant. You're not, unfortunately. You're going to have to wait for a spider to bite us to get that effect going and stuff, right? So both of the vaccines right now and the bulk of the vaccines in development are going to need 2 doses. So if you get the Pfizer vaccine down the line, it has to be given a minimum of 21 days. So there's no what's called a maximum time frame. So let's say, when you were due for your next dose, 21 days finish, you happen to be out of town, you come back the week later, can you get the vaccine? Yes. So there's only a minimum interval. There's no maximum interval of when you can get that second dose. It's important to get both the doses because that's how the vaccines have been studied, right? So when they sort of talk about, effectiveness and protection and all those numbers that you hear, this 90%, 95%, et cetera, that's based on getting both the doses. They don't have good, they weren't really evaluating what happens after one dose, right? So you don't want to stop at the end of one dose. You want to try to get both your doses going forward. And the Moderna vaccine needs 28 days between the 2 doses. Right now, because the 2 vaccines were tested independently, you can't mix and match, right? So many of us who have children and go to the pediatrician's office and, children get lots of vaccines, most of those vaccines can be mixed and matched with each other, right? So it's almost like, I can take the Ford brand car, I can take a Chevy brand car. They're both cars. They work perfectly fine because they've been tested over time to work with each other and not be a problem. But in this particular case, because the 2 vaccines were developed independently and tested independently, we can't say that you can replace one with the other. Now, down the line, as they do more studies, we may be able to say you can interchange them, but right now you have to get the same brand vaccines both times. So that's why it's important when you get a vaccine, everyone in America is going to get a vaccine card. So, for the folks that were back in the days, we used to get yellow cards when we got our shots. So almost like that, you're going to get a little white card from the CDC that lists which brand of vaccine you got. And that's why it's important to keep that so that when you get to the next one, in case you go to a different place, they know which brand you got the first time around. Next slide, please. So as I said, both of the vaccines were tested in a wide variety of races, ethnicities, ages, and they both show well over 90% effectiveness. So they're very close to 95% effectiveness in preventing serious illness from COVID. So, those are spectacular numbers. Those are numbers much better than we anticipated when we started this journey of developing our vaccine. Next slide, please. So some of the, what are some of the common side effects, right? So the first thing up front I want to tell everyone, right, the COVID-19 vaccine cannot give you COVID because there's no dead cell in there. There's no weakened virus in there. There's nothing in there that can give you COVID-19, right? So right up front, you can't get COVID-19 from getting the COVID-19 vaccine. I'm sure you've heard in the news recently, oh, someone got a COVID vaccine and 3 days later they had COVID. That can happen because that just meant that they were already exposed and were lucky enough to get a vaccine, but they were already in that exposure period. And most of us who are getting it right now are in healthcare, right? So we're seeing patients every day. Potentially, some of them have COVID, and there's a risk of transmission to healthcare providers. That's why healthcare providers are getting it first, kind of deal, right? From the clinical trials, there were no serious, significant side effects, right? So are there going to be side effects? Of course, right? So anyone who's ever gotten a vaccine, most of us get some degree of either a little redness or arm swelling or arm pain. If we've had the flu vaccine, many of us sort of have experienced those kinds of things. Many people interpret that as, oh, I got the flu from the flu vaccine. Again, you can't get the flu from the flu vaccine because it's a killed virus that's in there, right? So you can get, fever, chills, headache, arm pain, redness, all of those kinds of things, but that's really a sign that your body's immune system is working, not necessarily a unexpected bad thing that happened because you got the vaccine. I'm not saying you're going to get all of these symptoms, but these are relatively common things that may happen after you get the vaccine and stuff. The one thing that's slightly different about the Moderna vaccine versus the Pfizer vaccine is in the Moderna vaccine, you can sometimes get lymph node swelling also in that same arm, right? So it's not just that where you got the shot may get a little red. The lymph nodes under your arms or in that area can also sometimes swell up and stuff. And that's, again, typically, so the day you got the vaccine, so I got my vaccine today, so it's considered day one. So most of the time, if you're going to have these side effects in day 2 or 3 is when some of these side effects may start. And usually by day 4 and 5, all of these are gone away. And typically what they sort of say is, if you have arm swelling and it hurts, you can take Tylenol or Motrin. And most people will feel better afterwards and stuff. When the Pfizer vaccine was originally, when we started to give it in larger amounts of people, that we discovered that some people were having anaphylactic reaction. It's a minuscule number, so how commonly it's talked about in the news, you would think that it was much more common. So, like last week when I was originally preparing this presentation, at that point we had given about 500,000 doses in America. Right now we're up to about 4.5 million. Back then when it was 500,000 doses, there were only 5 reported cases in all of America of an anaphylactic reaction. Right? The big social media thing was, a lot of people were sharing, oh, this nurse in Minnesota died after she got the vaccine. She did not. She had a known, what's known as a vasovagal, right? So when she experiences any sort of pain in her life, she passes out. And, heaven behold, she got a needle in her arm. It hurts. She passed out. And of course, that video made it to the internet and everyone started posting that she died after she got the internet. She's been desperately trying to explain ever since then that she's perfectly alive and well. Her hospital is, putting up videos of her everywhere showing she's perfectly alive and well. But you know how sometimes things get on the internet and it just runs away and you can never take it back and stuff. So, she's alive and well. The other big thing that I hear about is, people talk about this, page 132 on the Pfizer documentation that talks about sterility. There's only page 53 there's only a 53-page document for Pfizer. So there is no page 132 for anyone to quote on, getting the thing. So what they're really looking at is something that sounds very similar to the Pfizer vaccine's name from some other place. And they're sort of saying, oh, that's the same thing. So that's where that comes from. Again, completely not true. It's been studied and these are the most common things that happen and stuff, right? I'll talk a little bit about who should get it, who shouldn't get it, who can get allergic reactions, et cetera. But what you should know is because you cannot get COVID from the COVID vaccine, you can't have those kind of symptoms, right? So if you lose your taste or smell, if you're coughing and having difficulty breathing, that's not the vaccine. That's probably you were already exposed to COVID. Please reach out to a healthcare provider and have a conversation with them and stuff, right? So if you're having the typical COVID kind of symptoms that we've all unfortunately gotten used to over the last 8-9 months, that's probably that you've been exposed to COVID, not so much the vaccine and stuff. Next slide, please. So what we don't know currently, right? So the vaccines in the trials, so the Pfizer vaccine had trials going on for about 4 to 6 months. The Moderna vaccine had trials running for about 4 months before their safety data was done. And all of COVID, in essence, right, so depending on which date you start, whether you think it started in November of 2019 versus, February of 2020, it's only been around for, 8 months to a year, right? So in all reality, we only know about COVID in that time frame, right? So we don't know right now, how long this vaccine protects for, right? So we know based on the length of the trials that at least for 6 to 8 months, there is some degree of protection, but only as we get more people past that window. So the people that originally were in the trial are ahead of the rest of us. So as they finish a year and if they still have immunity, if they finish 2 years and they still have immunity, that's how we're going to know how long this vaccine lasts for. And that's not unusual with any vaccine being developed, right? So anyone who may have had children who are now teenagers, when the chickenpox vaccine first came out, it came out as a recommendation for a single dose. And with time, as we sort of monitored how long that immunity was lasting, we realized that, down the line, kids were losing that protection. So then we added a booster dose, right? So it shouldn't be that we shouldn't take it that the vaccine didn't work if down the line the recommendation comes out that we need a booster dose. Or it may come out like the flu vaccine, right? The virus itself is very smart and it's constantly changing. So, we may have to develop versions of the vaccine down the line, right? So that we have to get every year, every 3 years, every 5 years, whatever it is, depending on what the virus does. And as Louis alluded to, there are a couple of strains that people are talking about right now. So there's a UK strain that everyone's talking about. It seems to be more infectious, but not necessarily more deadly. There is another South African strain that people are starting to evaluate right now that also seems like it spreads easier. We're not quite sure about if it's more deadly or not. That's what the studies are going on. There may be cases that may have been around in the U.S. much longer than just the first case noted in Saratoga. And part of the reason behind it is in the UK and other parts of the world, they routinely look at the different strains. In America, for some strange reason, we don't routinely look at the strains that are out there, right? So we're always playing catch up. So when someone else develops a new strain, then we're sort of we're looking for that particular strain. Yeah. And I think what the governor said yesterday, the day before, at the federal level, it takes about 2 weeks for them to come up with a new strain analysis. In New York, some of the, because we're lucky, we're surrounded by world-class health facilities around us, they're able to do the strain analysis in the matter of a couple of days and stuff. So, we're always playing catch up, but we do have the technology to keep track of what those strains are doing and where that's going to head up. So recommendations may change, but right now the belief is that even for the UK strain, the current vaccine is good enough because the spike protein, that little red thing we all talked about, hasn't changed. So the vaccine is still effective in developing antibodies to that and stuff. So that's where we hope to stay. The Pfizer vaccine was tested in children 16 and above, which is why the recommendation for the Pfizer vaccine is people 16 and above can receive the vaccine. The Moderna vaccine originally was only tested in people 18 and above, and that's not unusual. So many times when they do vaccine trials or medicine trials, typically pregnant women, very old, frail people with immunocompromised issues, young children aren't lining up to, join any sort of trials, right? So most people that join trials are, relatively young, relatively healthy people because, they want to be helpful to society and, they think they're more invincible because they're younger and healthier and stuff, right? So that's not unusual that the first group tends to be a young, healthy group and then they add additional groups. So Pfizer is now currently evaluating 12 and above. Moderna is working on adding children also to their vaccine study so they can sort of come up with additional recommendations down the line. We don't know right now, can the COVID vaccine, so when it's available for the general public, can the COVID vaccine be given with other vaccines, right? So, many of us, depending on what time of year it is, it may be time for a flu shot or a tetanus booster, or for, when we get to kids getting vaccines, kids are getting other vaccines. So we don't know yet, if they can be given together because that's not how it's been studied. So as a precaution, the current recommendation is 14 days before you get your COVID vaccine or 14 days after you get your COVID vaccine, you should try not to get another vaccine. Now, if it happens for some reason, like you forgot, you lost track, the vaccine dose still counts. They just tell you, like, as a precaution, it's better to sort of give yourself a 14-day window before and a 14-day window after you get the COVID vaccine, just to make sure both vaccines work as effectively as they need to. Next slide, please. So, like I said, who's recommended to get the vaccine? The Pfizer is for 16 and above. The Moderna is for 18 and above. Right now, the primary rollout, and it's almost by the hour, we're getting additional guidance from the state and from the federal government because, the vaccine uptake hasn't been as rapid as it was originally anticipated. Originally there was a hope that before the end of 2020, almost 20 million people would get it. To me, that seemed like a big push because, it was the holidays, people are away on vacation. People don't necessarily want to do some of these things when they're, getting ready for the holidays and stuff like that. But, so originally it was intended for hospital workers. So whenever I refer to healthcare personnel, it's not just the doctors and nurses and the medical assistants. It's really anyone in those facilities that deals with patients or infectious material, right? So it's the cleaning crew, it's the security staff, if you're in a hospital, it's the people that bring food to the different floors, right? All of those people come under this umbrella of healthcare personnel. So the first people that in both federally and in New York State that they tried to get the vaccine out to were frontline healthcare workers in a hospital setting. Once they started that rollout and, got it started, then they reached out to places like where Louis and I work, federally qualified community health centers, because we work primarily in underserved communities to make sure that the healthcare personnel that work in our kind of facilities also get that level of protection. Then they added on people like EMS, fire, police to that group to get vaccinated. Now they've added on public health workers, people that work in jobs like morticians, people that work in long-term care facilities, nursing homes. So, they're trying to expand it as quickly as they can to match vaccine availability, the ability of people to vaccinate people, as well as, get enough populations going. The first round of the general public, quote unquote, that probably will start being called in for immunization, at least from what the feds are recommending, is 75 and above. And then after that, it'll drop down to 65 and above and other health conditions and so forth and so forth. Right now, this is a guesstimate because a lot of these things, like I said, literally by the hour, we're getting updates from either the feds, the state, or the city on who is now eligible to get vaccines. I anticipate that probably later into February, maybe into March, is when, more of the general public sort of categories will start kicking in. And it all sort of depends on, because, next in line will probably what's called frontline workers. So those include grocery store workers, teachers potentially, people that work in the transit authorities, so all of those kinds of things that have all kinds of people that have generally more contact with outsiders. Are probably going to be next in line. But again, a lot of this is still to be determined. Next slide, please. So the other big question comes, I already had COVID. Should I still get the vaccine? Yes, because the belief is that the COVID vaccine actually has your body generate a much higher antibody response. So even if you had COVID, you can benefit from getting the vaccine and getting that higher protection, which may be a longer lasting protection. If you currently have COVID, right, so like let's say yesterday or the day before you got your test results back and you're COVID positive, they recommend that you should first finish your minimum 10-day of isolation. It's not so much so that, if you got the vaccine, then anything bad's going to happen to you. It's really because we don't want to risk people that are potentially infectious going out to some place to try to get a vaccine, right? So you want to make sure they finish their isolation period. They're no longer infectious before they go out into the community trying to get a vaccine and stuff. If you've had a COVID infection within the last 90 days, this is not saying that you should not get the vaccine. It's sort of saying, let's say there's only 2 doses left at a clinic, and you and your spouse or you and your loved one are both there, and one of you had a COVID infection within the last 90 days, the other person did not, you may choose as a family to sort of say, the person who has no protection probably should get that one remaining dose, because right now the belief is that probably for the first 90 days after you got an infection, you have enough antibodies that you offer some level of natural protection. There are some very small studies that say that infection protection may last up to 8 months, but it's not enough to sort of make that as a general recommendation. So that 90-day window is where we sort of say about 3 months after you've had an infection, you can choose to wait a little bit longer to get the vaccine. So if you want to get the vaccine, you certainly can get the vaccine, but if you want to wait, you have that 3-month window to get the vaccine. Next slide, please. When it comes to pregnant and lactating women, again, like I said, typically that's not the population that's coming up front volunteering to be in trial, so they really weren't studied. That being said, the American College of Gynecology, which is like the national expert on, pregnancy and women's care and all of those sort of stuff, based on their analysis, they do not believe that the mRNA component, which is what sort of comes into our body to make this immune response, will affect pregnancy or lactation in any way whatsoever. So they actually say if you're pregnant, have a conversation with your healthcare provider, and you can choose to get vaccinated if you want to. And many healthcare workers who are pregnant have chosen to get the vaccine because, yes, there's an unknown about the vaccine and being pregnant or lactating, but there's an even bigger unknown of getting an actual COVID infection and being pregnant and lactating, right? So it's a risk-benefit analysis, and it's going to be slightly different for everybody. So that's why the recommendation is talk to your own healthcare provider, talk to your family, whoever it is, and it's up to you guys to make that determination. But if you want to, you can get the vaccine. If you're immunocompromised, like if you have HIV or if you're on high-dose steroids for long periods of time, if you're getting cancer treatment and stuff like that, it's not that you cannot get the vaccine, but because your immune system is already weak, we do not know how much of an immune response your body will generate to the vaccine. So I can't give you that same 95% confidence in an immunocompromised person. So will it offer some protection? Most likely it will, but we just don't know what that number is to say, this percentage protection you're getting because your body's immune system is not working as it is. The other big thing that's out there is, people were talking about, there's fetal material in here. I'm a Catholic, I'm religious, I'm whatever, so I can't get this vaccine. There is zero fetal material in either the Pfizer or the Moderna vaccine. The mRNA that's in there was synthetically created in a lab. So it was created in a petri dish. There's no, human byproduct in there and stuff. So feel confident that you can receive this vaccine. Next slide, please. So how do we know after a vaccine is developed, what's happening to all these people that got vaccinated, right? So we always had a system called VAERS. VAERS was a system where anybody, so whether it's a healthcare provider, it could be the person who got the vaccine, it could be their guardian, if they developed in some sort, and there's no definition of what's an adverse reaction to a vaccine, right? It's for the healthcare provider to determine, it's for the person to determine. If they thought they had an adverse reaction to a vaccine, they can go online or call this number, or call a number and get access to what's known as a VAERS system. And that's how all vaccines that are out there are monitored in the long run, right? And, what's the impact of that? So probably about 10 years ago, there was the first generation rotavirus vaccine. So any parent out there, please don't stop giving your children the rotavirus vaccine. It was the first generation of the rotavirus vaccine, which seemed it was safe in all the trials, but as we got to larger populations, some of the children were getting this condition known as an intussusception, where their gut was sort of sucking itself into themselves, right? And once, enough reports were coming to VAERS, that vaccine was then pulled off the market, right? So there's always constant monitoring of anything that comes out, whether it's medication, whether it's vaccine, it's continued to be monitored even when it comes out and it's authorized. So be reassured of that. But, that's like 19th, 20th century technology. We're sort of in the 21st century, right? So in addition to that, the CDC has actually created a new text-based platform called vSafe. So when you go to get your vaccine, they'll give you either the website or a QR code that you can scan. Once you scan the QR code, you answer just a couple of basic questions about which vaccine you got. Then weekly, for the first week, you get a text alert that checks up on you, right? that sort of says, how are you feeling? Do you have a sore arm? Did you get a fever, et cetera, et cetera? And then if you said yes to any of those questions, did that then stop you from working or doing your normal activity, et cetera? And then based on that, you may get a call back more urgently from the CDC to follow up on those kind of things. Or if you're doing well, like my wife did and like I'm doing so far, it's just a reminder to sort of check up on you. So you get a daily text, asking you how you're doing. Once that first week is done, you get a weekly text for up to 6 weeks, and then another follow-up at 3 months, 6 months, and 12 months. And then when you get the second dose, it starts all over again. So after dose 2, again, you'll get weekly texts and stuff. So I signed up this morning when I got my vaccine. I already got my first day's check where, several hours afterwards it reached, I got a text alert saying, how are you doing? And then asked me to answer a couple of questions and stuff. So that's a more real-time monitoring of, how people are doing, and then if people are having adverse effects, it gives an option for the CDC to directly contact those folks and get additional details and then make determinations and stuff. So there are now 2 different systems that are monitoring the vaccine safety as it's rolled out to more people. Next slide, please. So the other big question, and it's so funny, my cousin actually asked me the exact same question, like maybe 30 minutes ago. She goes, oh, so you got the vaccine, you can stop wearing your mask, right? No, because again, it's 95% effective, but it's 95% effective in most people, right? So there's going to be that few people that it only was 75% effective, right? There are going to be a bunch of people that are going to get the vaccine later. There are vaccine people who are, going to choose for whatever reason that I'm not getting the vaccine, right? So you're going to always have a mix of people that are out in the community. So just because we got the vaccine does not mean we change anything yet. Now, down the line, as more people are vaccinated, as we can see what the numbers in our community looks like, our numbers in our state look like, numbers in the country look like, then as Dr. Fauci says, maybe if a significant enough portion, and I think the numbers he uses is around 70% of the population, has either had the disease or had been vaccinated, maybe by late summer, early fall, we may be able to take away some of those restrictions, like do we have to wear a mask everywhere, or maybe only wear a mask when we're indoors, and, or maybe only when we're within X feet of each other and stuff like that. So that's the great hope that all of us are aiming towards as we look forward to 2021. Next slide, please. So, that's the basic presentation, but, I want to sort of reassure everyone that, I think when each of our different categories are ready for the vaccine and are offered the vaccine, there's going to be different ways for people to get the vaccine. So right now, what it seems like is going to happen is as these categories of people are reached out to, so organizations like hospitals, like FQHCs, like where we work, other urgent care locations, some of those people will start vaccinating their own patients that fall into those higher risk categories. And then when it gets to general public, most likely the city, the state, places like Urban Health Plan are going to have to set up vaccine clinics, right? So even though you may be a patient of our regular clinic, I may tell you to come to this location, which is purely for vaccines, right? So I don't have to have you wait in line with everyone else who's coming in for regular checkups and stuff. You can just go to a place, get your vaccine, go home kind of deal and stuff. And that's most likely how most of us will get vaccinated in the long run. People who've been around long enough may remember, when people got the first generation polio vaccines, many of us who come from other countries. So, when I visit India, even as recently as about 10 years ago, my kiddos were tiny. We were at a bus stop in India, we were waiting for the bus, and, they just so happened to be public health workers out there in the community giving the polio vaccine. They saw 2 babies in the street, and they're like, oh, can we give the baby the polio vaccine, right? So, there's going to be a massive public health effort to get as many people immunized that want the vaccine. With that, I'm open to questions.
Yeah, thank you, Dr. Jacob. I think this was a really, really informative presentation. Although I thought I knew something, I found out that I knew nothing about it. So I just have some questions. I don't know if people may have some questions. If maybe Cynthia can help us out. If someone have written questions on the bottom of the screen, but I have I just have one question, like 2 or 3 questions. One is the recommendation to be vaccinated is or either 16 and over or 18 and over. So what does that mean? That under 16 should not or cannot?
So right now they cannot. If you're in a practice that most of the way the vaccines are split up right now is the hospitals and hospital clinics have access to the Pfizer vaccine, because the Pfizer vaccine has to be stored in like minus 80-degree temperature. So it's what's known as an ultra cold freezer. Mm-hmm. So most of the time, regular community doctors don't have that kind of freezer. We just have regular vaccine freezers, right? So hospitals typically have those ultra cold freezers. So hospitals are getting the Pfizer vaccine. The Pfizer vaccine also comes in lots of 1,000. So the minimum order you can place is 1,000, right? So if you're a mom and pop doctor's office, you may not need 1,000 vaccines in your practice, right? So that's why most of the outpatient practices are probably going to get the Moderna vaccine. So, what Urban Health Plan has received and has been administering to our staff is the Moderna vaccine. So it depends on which vaccine. And then down the line, as additional vaccines are available, they may have their own specific age criteria. So places that have the Pfizer vaccine can give it to 16 and above once those categories are available, so when those people are allowed to get the vaccine. And then places that have the Moderna vaccine right now can vaccinate people that are 18 and above for now.
Okay. So I have another.
I'm sorry, Louis. We have Paula and Jennifer that have questions also, okay?
Paula, go ahead, Paula.
Yes, good evening, Doctor. Thank you so much for a very informative and intellectual presentation. However, I'm a woman of African American descent, and I'm very skeptical due to the history of the government on my ancestors. First of all, I would like to say. Second of all, does this vaccine have the MRC5 in it?
I don't know off the top of my head. I have the vaccine components in another presentation. I'll come back to that. I'll give you an answer in a second.
Okay.
I completely agree. There is legitimately mistrust in many communities of color, right? So Puerto Rican communities have had issues where the government has done very interesting things in the past. African American communities have things done in the past. So I completely agree I completely understand the hesitancy, but hopefully with time, with sort of seeing that as opposed to in the past, the trials itself were on a mixed community, that it sort of with time it will reassure more people. Hopefully, as more and more sort of prominent people step up and are vaccinated and feel confident in vaccinations, that will spread the message as well. So if
you have pre-existing conditions like a lung condition as asthma or any type of lung disease, could you be exempt? Because I understand a lot of agencies and companies, not the government, but other companies and agencies are sort of like telling their staff, if you don't get this, you don't have a job, sort of type situation. So if you have pre-existing conditions that you have allergies, let's say, could you be exempt from getting the vaccine?
So you actually bring up a very interesting question about allergies, and I didn't go into the details of that. But right now, the only people that should not get the COVID-19 vaccine are if you've had a previous adverse reaction to if you got the first dose and had an anaphylactic reaction, meaning you had trouble breathing, your throat swelled up, et cetera, then you shouldn't get a dose 2. If you had a previous anaphylactic reaction to an injectable medication or vaccine, then you should probably hold off on getting the COVID-19 vaccine. If you've just had anaphylactic reactions to oral medications or food or to the environmental things like pollen, et cetera, you can still receive the vaccine. You just have to be observed for 30 minutes versus the 15 minutes that everyone else gets observed for. So having an allergy itself is not a pure contraindication. The question about can companies mandate specific kinds of things? That's a very important question, but that's not a question that we have an answer for yet, because no government entity has said that they cannot do that. And, in America, unfortunately, they give lots of sort of leeway to private companies and private agencies to do their own sort of thing. So individual locations, I've heard of one instance in California where there is a company, I forget what kind of company it was, but they're sort of, quote unquote, mandating their staff to, when it's available, that they have to get the vaccine or they cannot come to work. Unfortunately, that may happen. And, I don't know what the next administration's policy on that is going to be.
Okay, thank you so much.
I'm sorry, Paula. We have Jennifer, Vanessa, and Julia. And then, we're kind of skimpy there on time also, so just keep that in mind.
Doctor, thank you for the presentation. I'm an age skeptic, and I've read a lot, and everything that I have read, you have actually answered. And you make it sound extremely appealing to get the vaccine. But my question is this. The vaccine was developed extremely quickly. There's no studies. We don't know the long-term effects. And my question is that there's the flu vaccine, which is constantly changing, and the vaccine isn't always effective. There's cancer. There's AIDS. There's just so much that's going on that has been studied for years, and there's no vaccine or cure that is available. But this was developed so quickly. Do you really think that, in my personal opinion, I feel like we're kind of like guinea pigs, so I'm extremely skeptical on getting it. What is your opinion on the fact that it was developed so quickly and how, it might affect all of us for the future?
So I think I mentioned earlier, a typical vaccine trial or medication trial, right, the rate limiting step is really money, right? The reason why trials take a long period of time is because many, companies don't want to put down billions of dollars into one project, right? They'll put down, I'll give you $100 for 10 projects, and then, a couple of them will work a little bit, and then I'll give you a little bit more, and so forth and so forth. The advantage that, these particular vaccine trials, so, right now there are 4 major vaccines, and then there are multitudes of, vaccines that, that are being developed out of China, Brazil, India, et cetera. But the advantage that most of those companies that are developing got was that, countries around the world put in billions of dollars up front. So they said, we're going to help you set up. So we're not going to do the research, right? The research is for you guys to figure out, but we're going to help you set up the factory, what kind of bottle you're going to put this into, the ability to sort of ship this to different places and stuff. So we're taking that risk out of the pool for you, right? So all you guys need to concentrate on is doing the research on the actual studies that are out there, right? So the mRNA technology, right? So the BioNTech vaccine, which is the Pfizer-BioNTech vaccine, it was primarily developed by a German company. So the BioNTech part of Pfizer is a small company that's out of Germany. And it's actually a husband and wife team, a Turkish husband and wife team of clinicians who spent their entire life studying mRNA. Right. So when this opportunity sort of came to them where, the whole COVID pandemic was going, they sort of took their existing research and sort of tailored it towards looking at a way to use that mRNA technology to sort of come up with a vaccine product and stuff, right? So it was the right time. Technology has changed. Our ability to sort of so 10 years ago it would have taken us like decades to just figure out how to sequence the virus, right? Right now, like almost within months of the virus being first discovered, the genetic code was actually put up on the internet and shared with the world, right? So it basically, typically researchers are very, they want to be the first, right? So they hide their own information. They don't give it to anybody and stuff. So in this case, they actually just put it up on the internet and sort of said, look, this is the sequence, try to figure out a solution. So, people from all around the world were working with it. They were working in parallel with each other, using the existing technology and stuff. So they didn't really skip any of the steps. They did all of the steps that, any medicine that we get, any vaccine that we get, it's just because the risk of the money was taken out from the companies, that sort of put into effect. So then people go, but I don't trust the current administration and, Unfortunately, our current president has a way of sort of interjecting into things that he sometimes shouldn't be interjecting into, right? But the same vaccine has been independently authorized and studied in Canada, has been authorized in the United Kingdom, in many parts of Europe. So there is no direct influence of our government or our policies and stuff. Right? So they all have independently looked at these vaccines and authorized them. So, I think as much as I can try to get the message across is that no steps were skipped to make the vaccine. It was just a combination of, having the available technology. I sort of say just having the Zoom meet, right? So 5 years ago, if we tried to do this exact same thing, we'd all be lagging and, lots of sort of spinny things going on. And, we have Jameen who's driving and on a video call, right? So, that's how technology has changed, right? So just like that, the technology and the research has also changed in advance and allowed us to get to this point. So, I got the vaccine, so I always use that as an example as a pediatrician. My children get all their vaccines. I don't hold off any vaccines from them. So I reassure my parents that I deal with that, as far as I've looked at the evidence from the expert, I feel it's safe, and that's the reason I recommend it to others.
Yeah, and just before we go to the next question, I just want to make
Louis, before you go into the next question and make your statement, it's 6:02 right now, and we have two major items for the housing committee. So
it's really, really important. This is like right now we just want to educate people about the COVID vaccine. There's so many skepticism out there, and we just want to make sure people have their answers. Their question answered.
I understand.
So my comment was going to be like going back to what one of the questions about skepticism and the community of African American and Latinos. This is an issue that is not only affecting the United States, it's affecting the whole world. The vaccine is given to the whole world. It's not only a group. So I think this is something that we have to look at it. What was the next question? Ralph?
Vanessa, who left in the chat, and just for the sake of time, something's going on here. Is the vaccine going to protect you against other strands of COVID-19, or do we need to get vaccinated for every strand? And then Julia, and I think we need to move on after that, Louis.
So right now, the belief is all the strains that we know of, the vaccine will protect against. What will happen in the future, we don't know yet.
Okay, great. And then Julia has a question.
I work in a nursing home for 28 years. I was in the forefront of all what happened over about a year now. I'm working with people that have been affected with COVID. Most of the staff, myself also, became ill. We started the vaccine. We were the first ones to start the vaccines in nursing homes. So my problem has been, I want to get to that 75% herd immunity. It's not only my responsibility, but it's just a community responsibility. And yes, we're in a yellow zone. That means that we got to take care of this community. We test twice a week so we can work. While everybody ran home, we dealt with the virus. So my comment to the team is, it's okay to get a lot of information, but sometimes too much information is making people afraid. So if we can just give basic information, I learned that out of my 100 residents in St. Vincent de Paul, 69 of them got the vaccine, which is a good percentage. I wanted more. I'm going to shoot in a couple of weeks for more. In the other facility I covered, 600 residents, and not even half of them got the vaccine. So my concern is that maybe we're loading up with so much information that the older generation, I can only speak for the older generation, is going like, oh my God, they're trying to convince me so much and look at all these numbers and everything that they're treating me like a guinea pig. So we need to probably just get to the point with them, get to the point with staff, get to the point with people so that we don't lose them in the translation. So my concern is we got to get to that herd immunity so that this could be effective. And yes, continue wearing your mask. I wear my mask all the time. and I encourage my seniors to wear the mask. So I think sometimes getting to the point might be more better for mostly the older generation.
Jacob?
Thank you so much for all your hard work with the communities that are in highest needs and stuff. So if I can leave one message behind, right? So are there some unknowns with the vaccine? Of course there are, right? But there are just as many, if not more, unknowns of what happens when you get a COVID infection, right? Because it seems to be such a hit or miss proposition, right? You have elderly folk who get it and do okay. And then you have like very young who get it and pass away. Like, you know, just in the last 2 weeks, there were case reports of, you know, several teenagers who within several days of just getting the virus passed away and reportedly had no other medical conditions, right? So it's such a hit or miss proposition that I get it that there are some concerns about the vaccine itself, but there's just as much concern that should be in our minds that of the virus itself, right? So, you know, I think all of us have to make our own decisions, but, you know, I think if I can leave that message behind, that the virus is definitely more dangerous than the vaccine will be. So.
Yeah. Okay. Thank you very much, Doctor. Thank you. I really appreciate coming in. This is a part of the health committee. I'm just going to leave you with Paula. She's going to be managing the next part of the meeting. Thank you very much.
Thank you, Doctor.
Paula, before you take over, I just want to
Thank you.
Before you take over, I just want to thank the doctor for giving us all that information. It's very helpful to understand it and to understand what the only problem is. Again, I have a problem with only 10% of it was African Americans and 13% was Hispanic, when that community between blacks and Hispanics was mostly hit the hardest. And we needed to do more testing on that side than on any other side. But that's a discussion for another day. So again, Doctor, thank you very much for everything. Louis, thank you for bringing this presenter to us. And Paula, you're on.
Yes, good evening, everyone.
I'm sorry, Paula.
Okay.
Paula, I'm sorry. I just want to, before you start, I want to acknowledge that we were joined. We do have some representatives from some local officials here. So we had Emily, I think she's still on. And if not, Angel's still on from Senator Biaggi's office. And then we was just recently joined by Monica from Assemblymember Burgo's office. And we have Councilmember Salamanca on with us now. So I just want to acknowledge that.
Thank you. Good evening, everyone. Happy New Year. This is Paula Fields Conyers. I am going to pass is Minnie there?
Hi.
Hi, it's Minnie.
Hi, everybody. Happy New Year.
Happy New Year,
Minnie. Presentation is Minnie.
Which one are we doing first?
Number 2.
No, I know. We have 2 projects. Which one are we doing?
The one for the La Peninsula project and Melrose Clusters, the update.
The update on the Peninsula. Okay, great. So I think that there's a bunch of folks from the development team at Peninsula 1A and 1B on the call. I see Bertka's on. I presume, who else is on? I can't see everybody.
Hi, it's me. Josh is here. I can share the presentation on my computer if need be as well.
Yeah, I think that Bertka sent you oh, there it is. Okay, that's great. Thank you, Ralph. Okay.
Follow me, Sweeney. I think I got 2 presentations from you.
Yes, one for this one and one for the next one.
Yes, okay, great.
So we can just dive in. We're really happy to see you folks, and we're happy to be here. We're happy to share information on the progress of Peninsula 1A and 1B. So, Ralph, if you want to just go to the screen, we'll walk through, and then we can answer people's questions. So, again, this is just Bertka and Josh and Serena. Do you want me to go ahead and do some of this?
With 1A and then 1B, and we can both do the hiring.
Great. Okay. So basically, this is just a reminder of the whole site, and that we're working on the red on 1A and 1B. Although over the last while, there's been some, we did a bunch of groundwork in the phase 2, where building 2A and 2B are going to be, in terms of there's some groundwater showing up and we're emptying it, et cetera. But today the main focus is around the status and of the buildings 1A, the light industrial, and 1B. So Ralph, go ahead. And so these are pictures of building 1A. That is waiting for the glass. So the glass is here. That's going to be the special bend. It's called bend time glass. It's going to go along the west facade, and then there'll be glass panels that are on the backside of the sawtooth. The sawtooth has solar panels on it. So we're expecting the bend time glass to be installed over the next couple of weeks into building 1A, which will then actually make it look much, much more complete. And Josh, Rebecca, Serena, do you want to mention 1B?
Sure. Can you hear me? My computer seems like it might be freezing.
Yes, we can hear you.
Okay, great. Okay. So at 1B, first I have some images from the street, from Tiffany Street. You can see that we finished the full height of the building. On the next slide, we have a couple images of the top off. The last plank went down on December 10th, which is good news because that means no more plank delivery, the long trucks. We had a little write-up in the Bronx Times, and I think most of you should have received email notifying you of the event, and we put together a little video of what we've done to date with the demo of the juvenile detention center and where we are now, and we'll keep adding to that video. Thanks to Manny for orchestrating. The main pieces of update. If you haven't gotten that thank you, please let us know. We'll shoot you over. It has some nice images and a link to the video. The next slide with the text and the image of that final plank is the main takeaways here is that we are now 50% complete, and we're targeting February of next year, so 13 months from now, to complete the site.
I think the pictures are a little out of order, Josh, so I think we can just, they're after the next slide, which is the 1A status. So I can just say that, and then we can go through the other pictures that you're referring to. So basically 1A is 85% complete. It is behind schedule, but has given us time to do some excellent work outreach to local entrepreneurs. And right now we are actually getting ready to sign our first tenant term sheet with an organization that makes cake pops, and that we want to relocate. We also have, and actually, Ralph, I will circulate. I did not include this slide, and Bobby and Paula. We have several Bronx-based entrepreneurs that want to relocate into Building 1A. One is a coffee maker that is actually currently at the Bank building and can't afford to stay there, and was very, very excited about working out a prospective lease arrangement with us in building 1A. So now that the building is up, there's been a lot of interest. Our next site visit for prospective tenants is this Friday morning. So we're almost doing like one visit a week with prospective tenants, getting them excited about the space. And we are on schedule to actually start occupancy in March.
Great. Should we move on?
Yeah. Yes. I'm sorry, Ralph. Yeah. Keep going. Yeah,
That's okay. That's okay.
Sorry.
So we're going back to these are the same images we just saw.
Keep going. Yeah. Keep going. There they are. That's what Josh was referring to when they put the last piece of plank on the top of the building.
Gotcha.
Sunny day.
And he mentioned it was in the article in the Bronx Times, so we see that, the link there.
Yeah.
So now we're up to, and he did discuss this, the construction should be ending in 2022 with 50%. This was all discussed by Josh. So should we move on?
Sure.
Hi, I'm back. Sorry about that.
That's okay.
And then I think this is both 1A and 1B. This is just letting people know, again, we just heard the whole COVID presentation, which was really illuminating. And so these are commitments we made to the neighborhood in terms of pollution, noise pollution, interference on the streets, safety, and then recently that we had not planned for was the COVID. So our sites are all following the protocols that we agreed to with the community board and the council person and the other elected officials.
I'll add to that DOB has come to our site a number of times since COVID to, one, make sure that we're following COVID protocols, and two, that the site remains safe. It remains our priority to ensure that the site is safe and that we're following COVID protocols, and we have not received any violations from DOB. So we'll continue to make that a priority and have stand-downs at the site with all the workers, informing them of our protocols. The next slide. We continue to work with Crescent Consulting to provide ongoing compliance monitoring for minority and local hiring. They're tracking all the hiring that takes place on site. We are working along with Bronx Works and Sustainable South Bronx and Workforce One. About a year ago, we had an event to create a list for locals. And we continue to pull from that list and provide it to all our subs. And we encourage, and they make commitments to hire locally when and wherever they can. Next slide. We provided some data of where we are, a snapshot of where we are today with regard to the local and MWBE hiring. Ismini, you want to walk through?
Sure. So at 1A, we are a little bit low on the women and minority-owned businesses, but we are doing extremely well with the local businesses, vendors, suppliers, and subcontractors. And then we've hired 20% of the workforce has been from local Bronx residents.
And at 1B, we're continuing to stay on pace to achieve and ideally surpass 35% MWBE hiring goal. So as we're 50% complete, we continue to work with our relationships, as mentioned in the previous slide, to more MWBEs and locals. We've got strong numbers at the site, but we're never going to stop at any certain percent until the project's done, and we're just going to keep making sure that we continue to achieve our goals and surpass them with regard to hiring.
Excuse me, before you go any further, Ismini,
yeah.
When we talked the last time, you were supposed to, I know you provided us a list, but there were some questions on some of the companies that you had on that list, and you were supposed to provide us information on it, like your security company. And I just can't get, because I came in late.
Bobby, you're correct, and 1B has the list, and I was waiting because I was working with Omaro at Crescent, and he was having a tough time with the 1A site, and so I held off giving you the 1B without the 1A. We'll just send the 1I actually, and I finally said to Becca, but I think it was just too late. We will send it to you, both 1B, and then I'll send you 1A. I don't know I just looked at it tomorrow.
The other companies, because I came in late and I ran in through the door and put you guys on, but I know that the security was a concern because I never heard that company, and you had them down as a local company. So,
right.
And so that brings a concern.
Yeah, that's yes.
Security, and we can provide you with their further information about their whereabouts as well.
But not just their whereabouts, but their sort of their portfolio. What makes them? What made them the top company for this project?
Sure.
Okay. Go ahead.
Now, is there more to the presentation?
Nope.
Yeah, that's about it.
It's just it.
Some backup on the next few slides, but it's just backup that Robert had asked for.
Okay. Is the councilman on? Maybe to ask some questions.
I think he has his hand up, and we have please forgive me for my name, Berkey Kala Mugu has her hand raised, but the council member also had his hand raised.
Yeah, very quickly. First, I'm really excited. Thank you for having me. It's great seeing you. I saw you a few weeks ago when you did the topping off for the peninsula. I'm just curious, and I just want to make sure, so that the board understands. How many phases is this project? Is it 3 phases? How many closings are there? And how many closings have occurred? And how many closings have not occurred?
It's a great question, Councilman, and we don't exactly know. So basically, there have been 2 closings so far. And we expect, and the way that we presented the project and the way we expected the project to flow was actually in 3 phases. And we could actually go back, if we went back to the very first slide, 1A and 1B was phase 1, 2A and 2B was phase 2, and then building 3 at the corner of Menard and Spofford, where La Peninsula is right now, was phase 3. Okay, and so ultimately there could be 5 buildings that are going to get built. Okay, 5 separate buildings. What we really have not yet been able to determine with the city is we would really like to close the phase 2 buildings, 2A and 2B, at the same time, either as one closing or as 2 closings, but simultaneously, because they're so interrelated in terms of how they're being built and what's going on underneath, which is actually parking, and how you enter into 2A. So the answer is it is 3 phases. Hopefully, and it'll be probably 5 separate closings, but still 2 closings in phase 1, 2 in phase 2, and then 1 in phase 3.
So how many closings are left? 3 closings. All right. And so, given what's happening with COVID, I know that closings have been delayed. Do you know where you're at on that list? And if so, what's your anticipation to complete the entire project?
Yeah. Well, I think we could. I mean, I don't know if you're asking if we could use some help, but the answer is yes. Basically, right now we are working like crazy, and Berk and Serena and Josh Tully to get this project to close in December of 2021. Okay, that's where, we would like to close it in June, but we do not believe that there's much likelihood of that happening. So we are trying to close both, and we would like I said, I think it's actually really important for millions cost not the only one, but the fact that the buildings 2A and 2B are completely interrelated, okay, that they close in the year 2021. And so that's where we're driving. We've been thinking about what we need to do politically, to be honest, to make sure that we are kind of in line for that. I think it would be a terrible thing for the 1A and 1B to be done and then to not have 2A and 2B literally underway. I think both what it says to the community and what it does to the community. So that's our goal. That is what we're striving for. We would love any help that you might be able to offer or work with us on.
Yep. The other thing to note is that if phase 2 and 2A and 2B are separate closings, our goal is to have them be as close together as possible because, as Mini said, they share a parking structure. And then only when that's complete and we have a daycare at 2A can we start on phase 3, which is the site of the current daycare, a great asset to the community. So, and then there's some calendar issues, making sure that they move during the summer months. But our goal right now is to get 2A and 2B closed as soon as and as quickly as possible.
Paula, are you talking about La Peninsula daycare?
Yes.
Okay, I just want to make sure. Thank you.
You're still on.
I think we're done. Ralph, what's on the next slide? These are just this is the list of the company. These are the list of the company funds.
And it's good to see some local. We do see some local. I see F&F Supply and I see Classico, so that's a good thing.
The slide went off, Ralph. I didn't get a chance to view it all.
What is the picture, Ralph?
Yeah, that one.
Going through them, I'm sorry.
Who's going to be doing the exterminating? Or have they reached out to minority businesses that exterminators? I know they talk about builders and labor and all that. However, once the builders are done, between the security and the extermination, have they reached out to minority businesses in that area?
Yeah. So Paula, so Manny will be the manager, and yes, we are both interested in local and or women or minority-owned businesses to do a wide array of the jobs maintaining the buildings, which includes supplying, some cleaning supplies to the buildings, exterminating to the buildings, and hauling of.
Okay.
So from the various, we've had 2 or 3 events where we've met local vendors, suppliers, and there are exterminators and suppliers, maintenance suppliers on the list. So those are who we're going to be reaching out to next.
Thank you.
Question. I know you've got Crescent Consultant, which is the ones that are helping you to stay in compliance with what we're.
Yo quiero hablar, I had a question.
Hasta gracias here.
Feliz año.
Hello.
Hi.
Hi. I got a question, sweetheart. First of all, you're talking about the one in Manaira, or you include it in that conversation? It's baffled because I hear phase A, B, because I want to hear about something the building is open already a couple of months ago, and the people apply and they send them back things that feel or feeling like something is wrong. Because from those buildings that we got in the community. All the time when they open, when they're going to do and they promise a lot of things to the community. At the end of the day, they change. And a lot of things going on back and forth, and that's not right because they have to respect the community. And I hear some people in the shelters, and they make an application and they got let it back and they say they can qualify. Wait a minute, something is wrong because I hear and I know the sometimes 10, 15, 20%. All the new projects, they supposed to include the homeless or the people in the shelter. And people in the shelter from this community, they don't count them. They don't looking for them. They bring in people from Staten Island, Manhattan, Brooklyn, out of the state, and what about the people that living in the community? I think that you have to thinking about that because the community concerned, and that's not right what's happened. For a couple of years back, they got play games with the community. Put more attention on what you're doing because that's not right.
Bobby?
Yeah.
And Paula, Altagracia is actually referring to 700 Monida. We have not started the marketing process for Peninsula 1B, the first residential building at the Peninsula. I think that, so just to give folks a quick update, we have not done any outreach other than to people with disabilities that are not members of the community board. And right now, we have a 50% community board preference, which is 46 apartments that have to go first to the community board and then hopefully even more. We are currently processing 57 applicants. We process more than there are apartments because people fall out sometimes. But yes, I am sure that people received letters that they may not have been eligible. Our phone number, our address, we did the intake in the Bronx. We really tried to make sure that people had access to us. So, Altagracia, if there are specific people that you know that feel that they got something incorrectly, please reach out to me. But right now, the only people that have been reached out to are members of community board 2 in the Bronx.
Excuse me, Mimi, the person is from the community board 2 because that person is born and raised here. And second, I tried to call you a couple of times and I don't got no answer back.
Okay. Okay. I'll call you tomorrow and we can talk about it. I don't have a message from you. I'll call you.
Thank you.
Presentation from Ms. Sweeney regarding the
I know.
HPD projects. Okay.
I just need to, Ralph, I just need to ask, I know that Crescent is supposed to be doing your employment consulting, making sure you stay on target. Am I correct?
Yes, that is correct.
I like to know, if possible, how many of them are community workers, and I mean community board 2? How much outreach was done to community board 2 for jobs? How many of them qualified? The breakdown of their qualifications, and most important, what was the racial breakdown on it? Whether there was.
Yeah. Bobby, can you say this again? Because I'm writing. So you want to know on the local hire of the actual individual workers, correct?
Right.
Okay.
And then I want to know what kind of jobs were hired, what was their specialties, if any, and then the racial breakdown.
Okay.
What was the percentage be African American and Hispanics?
Okay. So
I also want to acknowledge that we have Crescent on with Cecile Morrow Benjamin, so I just want to acknowledge. So Crescent is also hearing you, Chairman Crespo.
All right.
Yeah, and I think so Amaro, I will work with Amaro on what we did for outreach, how many jobs went to residents of Community Board 2, what the breakdown of those jobs in terms of what types of jobs and specialties, et cetera, and then the racial breakdown of those folks. Did I get that?
Yes, ma'am.
Okay.
Yeah, I can get you all that information, Robert. Also, in reference to the company you mentioned, King Security, they're providing security at the project site.
I saw Johnson. I didn't see no King.
King is providing service on Asmini's site.
But who's Johnson then?
Johnson Security, they're also a local Bronx-based business. Johnson Security has been around for years.
But I didn't. You're mentioning King, and all you got listed is Johnson.
No, if you go back another slide, keep going, Ralph. If you go back, they're King Security.
Providing security for Asmini's site, 1A.
For 1A?
Yes.
And then 1B is Johnson?
Is Johnson Security, yes.
And they're the ones that are going to be kept on for the building?
Oh, no, we're not. The building's actually right now, Bobby, do not have, we don't have a security company right now.
So 1A will be King after you open up?
Not necessarily. No, right now we're not, we haven't contemplated having on-site security.
All right, because I remember when you first made this presentation to us very early on, we had stated that we wanted to make sure that the grounds themselves had security. Besides the cameras, there was also security. And I want you to keep that in mind, because I don't want down the road people saying, well, I didn't know about that, I forgot about that, or whatever. It has to be on-ground security and as well as in the building. Now, your on-ground could do, the patrol in the building, check it, make sure, and continue working. But it has to be a combination of that. So that's what I'm trying to find out. Who's your actual security company?
Right. So right now we don't have one. You are absolutely correct. The community board and the councilman also brought this up as a place of interest and concern. We are concerned about security, as you could imagine, and it's a budget issue, and so we are working on it. And no, we have not selected a company as of yet.
And there's also the prevailing wages for the workers, right?
And yes, the maintenance staff will be members of 32BJ.
That's in 1A?
1A and 1B.
Okay. So 2A and 2B.
And 2A and 2B and 3.
Thank you very much.
We can move on to the next presentation from Ms. Meany, just to give us a quick update of what's happening here.
Sure. I think HPD is going to go first. I just want to, before I turn it over to HPD, I just want to let folks know we're really excited about this project also. And we have our architects on the call, Matthew and Andrew from Edelman Felton, Knox and Wood are on, and we'll do some of the presentation. And this is a home ownership project that we're doing. We were awarded as a result of an RFP several years ago.
Good evening, everyone, and Happy New Year. My name is Kay Real, representing HPD. We're here to present you with a proposed scattered site development project spanning Bronx Community Districts 1, 2, and 3, which we're referring to as the Melrose Open Door Cluster. The project is made up of 12 scattered development sites totaling approximately 70 units. These are cooperative home ownership units. And there are 2 sites in Community Board 2. One is a city-owned property at 1048 Vale, and the other site is a property owned by Neighborhood Restore at 1109 Intervale Avenue. Each site is going to be developed with a 4-unit building totaling 8 units coming to this district. The district was a winning proposal from a request for qualifications in 2014 that invited applicants to submit proposals to develop clusters of small, scattered infill sites that would otherwise be too small and difficult to develop on their own. These sites are not subject to ULURP based on the New York City charter requirements. 1048 Fail is only 4 units, and 1109 Intervale is not city owned. So while there's no formal role for the community board, we wanted to use this time to inform you of this development coming down the line in your district. So we're excited that this project will expand home ownership across the board. I'll now turn it back to Ismail to go over details.
Thank you, Kay. So I think we can jump through. So Manny was selected. We will be doing several things as part of this project. We will be developing it. So we'll, hiring the contractors that we hired, the architect. The architect's going to walk you through what they've designed for these 2 sites. We're going to give you a sense of the whole project also, just so you have a sense of it. All 3, so the sites that were selected for us by HPD and Neighborhood Restore fall in 3 community boards, but all fall in the Councilman Salamanca's district. So there's parcels in Community Board 1, 2, and 3. But all of them are with the same council person. And then we will actually be doing marketing, and we will also be doing educational homeowner education seminars and preparing people for home ownership the way that we work to prepare them for rental. So Ralph, you can keep going. Okay, I don't know if Andrew or Matthew want to introduce ESKW.
Sure. My name is Andrew Knox. I'm a partner at Edelman Sultan Knox Wood. We've been around for a number of years, and we focus very much on affordable and supportive housing. We've worked with Ismaini for a number of years as well, and we're very much looking forward to working with this project with you as a community and providing some home ownership opportunities in the Bronx.
Ralph? Okay, great. So this gives you a sense of what we're doing. These sites, I guess, really took the word scattered to heart. So they are all over the place. To the right top corner, Community Board 3, and Community Board 2, and then on the lower side, Community Board 1. So just to give you a sense how these 70 units are going to be developed over 12 scattered sites.
Yeah, because I'm taking some notes. I'm sorry.
That's okay. That's okay.
Paula, I'll send you the presentations also, Paula.
Okay.
Just keep that in mind. So we can just move on from here.
Sure.
Yeah. This is it's just a very dense slide. It just gives you a sense of every address. It tells you the size of the lot, and it tells you what's going to be built on that lot. And again, this is much more technical, and it's prepared by the architect so that they are following the rules, basically, around what they're allowed to build on each parcel.
Yeah, and I see both of ours are R7 ones, so that's I think falling in the realm there. Okay, well, let's move on. Same thing, right? Same premise with this one.
These are the 2 that are used. Yeah, these 2 are used special.
All
Great.
right.
Okay, Matthew and Andrew.
Sure, we can talk about this. There are 2 sites that we're looking for. This is 1048 Faley Street. This site is located at the end of a very nice row of brownstone or sort of limestone facades, 3-story walk-ups, and then to the north of this site, I believe it's a NYCHA project. There's a little bit of an open space, and then there's a larger multifamily dwelling, and that's what we're putting in there. Because of the width of the site, we're very much limited. Let me show you my face. I'm sorry. Because of the width of the site, we're very much limited to how high we can go, how high we can build a building without having to put in an elevator and 2 sets of stairs, which would make it economically not viable. Consequently, all of these buildings all of the developments are basically 4 stories, and some of them are 4 stories with a mezzanine, but this one is just 4 stories. Next slide, please. So in this, you can see it's a 4-story building. We try to keep the brick facade, which is consistent in the neighborhood. We have an entry, which is a common entry on the ground floor, and there's a slightly smaller apartment on the ground floor. And then there are 4 apartments upstairs. I believe this one has, these are all 2 bedrooms. Each apartment is on a single floor, and they're all 2 bedrooms.
That's a development that's on Ho. Excuse me. Is that the development that's on Ho Avenue? That we just seen?
On Faley Street. This is the one on Faley Street.
Yeah, this is 1048 Vale. I have one on Vale and one on Interville.
Yeah, they don't exist yet. They're vacant. These are vacant lots.
That's a rendering, correct.
Are they going to be self-heated, each apartment? Or is it going to be one central heating coming up?
The heating system is a single boiler. Yeah, the common expenses, I believe, are water and heating, I believe is that, and then the individual expenses. Don't forget, this is also home ownership. This is not rental.
No, I know that.
Yeah, and then it's the electrical and utility, that sort of is the common expense or the individual expenses.
Just the electrical?
Yeah.
We have it covered also in the next slides down the line. We're covering amenities and utilities.
Yeah.
All right. And all right. Go ahead.
Let's move on then. Okay.
Site is 1109 Intervale Avenue. This site is similar. You can see the elevations are similar. We have a strong upper body of the building made of brick, strong cornice, and an entry on one side and a residence on the other. And you can sort of see how we have planters on the outside to give you an additional sense of buffer to the edge of the building and an enclosure for the garbage, so it's not right out in the street.
Are those two-bedroom apartments only also?
No, this is three bedrooms on the upper floor. It's slightly bigger. This building's slightly bigger, and then on the ground floor, it's 1 2-bedroom because you lose some of the space for the common entry.
Okay. Thank you.
Okay. Next slide, please.
Okay, I guess is that it? We have amenities. I'm sorry.
What's the prices on these houses?
We're getting there.
Yes.
Just tell you
amenities.
Telling you how beautiful they are, and then
I know that there's gentrification coming, but I want to make sure that it's not like one sporadic shot. I
know, Bobby. We're trying really hard, and HPD can attest to how hard we push back on. We don't want to be driving gentrification. So we'll get to the numbers. We're not hiding from them. Go ahead, Matthew. Yeah.
Yeah.
Through some of the amenities, a lot of our buildings will be 100% code compliant, and going above and beyond some of that to make sure that we're compliant with HPD standards through the environmental green checklist. So some of these amenities do include obviously heating that's efficient higher than code standard windows, and providing homeowners with the base stainless steel appliance. Every single apartment in each unit in all the buildings across the project will receive a washer dryer hookup. All the buildings will have their own individual lighting, and they're all ADA accessible. Again, repeated, the first floor apartments will be ADA compliant or ADA accessible, part of the HPD requirements. Each building will have storage in the basement where applicable. We're also accounting for bicycle storage that could be either inside or outside the building. There we have paved roofs on the roofs, and we're having some nice designs where we have daylit stairs where applicable as well, where we're trying to utilize the core as most we can to just get that light coming back, because this is a single stair building limited to 4 stories. And as you saw in some of the renderings, we're trying to play off of some of the historic context that you see in the Bronx, which has the like these 4-story masonry buildings that has front recessed with some areaways, and we've reinvented kind of where you put your trash and how you have planters to try to incorporate some of that history in the front of the building. And as I believe, Bobby, you mentioned utilities was a question. Here we're seeing the co-op that the building structure is in is going to be managing the heat and the water, and the individual homeowner will be responsible for their own cooking and electric services. Next slide.
And I saw that you have recreational roofs.
So the roofs, without getting specific, the roofs will be paved and compliant with basically the latest local laws, which allow occupancy on the roofs. It will be limited to a number of people, but certainly this will give outside spaces to the tenants on the upper floors. And for the ground floor apartments, especially in the rear apartments, they'll have access to their own private backyards. Correct, the homeowners.
All homeowner. This
Yes.
is homeownership.
I apologize if I misspoke, but it is all homeowners.
Yeah.
Concern with that is who's absorbing the insurance on the roof?
I'm sorry, Bobby?
Who's going to be absorbing the insurance on the roof?
Oh,
If
it'll
you
be,
go up there and God forbid something happens, the homeowner, who's going to be?
so the building, so the insurance in a co-op, the building holds the insurance. So not only is the co-op itself paying for the water and sewer bills, paying, if in this case there won't be real estate taxes, but paying for insurance. So that'll be part of the cost of insurance. So let's just say that it's prohibitively expensive, Bobby, then the owners could choose to not actually go on that roof. It's just we wanted to make it available to them, and so we've built it into the design. We also have not sent the buildings out to bid yet, and we don't know if that will be like we don't know if the numbers will be prohibitively high. The numbers you're going to see on the next slides around the cost of the co-ops and the income levels that people need to buy them are really important to us. But the numbers we use to generate that are not based off of a construction number that we've gotten off of a bid yet. It's a preliminary number. So there's still some work. It's early in the process. We just wanted to come and tell you about these buildings and these homes because it's the first time we've been able to do home ownership over 10 years.
I heard somebody whistling out there.
Oh, I'm sorry.
And that's per apartment what you're talking about there.
So basically what this is showing you is there's a range. So the units, the way that we're thinking about it right now is that we'll take the whole construction number. We are looking at it per square foot, and then the sales prices will actually be based on a per square foot number, and the cost will be reduced by the HPD subsidy. So HPD, as Kay said, these lots are being constructed through a program called Open Door, and there is a subsidy that HPD makes available, and there's a state subsidy that is also available. And so between the state subsidy and the city subsidy, basically more than half the price actually, or maybe close to half the price actually is in subsidy, and then there's the private mortgage. And that's why, Bobby, what I was saying, the construction number is so important because, the lower we can get that construction number, the better it is on the pricing of the houses, of the co-ops, of the apartments. So basically, based on their size and again, I think there's a slide. I'm not sure, Matthew, of the range of the unit sizes, but basically, because the studios or the one bedrooms are going to range between, a studio between 450 or actually 500 and 550. And the one bedroom, 600, 650. So that's why there's a range of sales prices. And then what that also does is allows us to have a range of incomes for people to be able to purchase these apartments, these cooperative shares.
I got a question.
Go ahead.
My question is about those projects the lady talking about just now, HPD. So how the people can qualify? Where they have to look for application, and how much is the money? Because I hear she say about the monthly, but the price of the apartment, the person I want to take it, how much money they have to pay, and the first counting, and what kind of income they supposed to get it.
Right. That's what you. So Altagracia, I know you can't see this, and we can ask Ralph to make some paper copies. We can make paper copies and circulate them. So basically, so first of all, to answer your first question, this is an HPD sponsored project, and so the homeowners will be selected through Housing Connect, through the lottery. So there would be a lottery, okay? The second is that right now we're showing, and this won't be useful to you, but I'll throw out the numbers just so you, studios, which are again between 500 and 550 square feet based on HPD guidelines. The sales price is between 157 and 197,000, and the income required is between 46 and 57,000, and those would be as I get those incomes will change as the AMIs change, but that's right now. The one-bedroom apartments are going to sell for between $200,000 and $260,000, with an income needed to be between $58,000 and $75,000. The two bedrooms are going to be between $239,000, $240,000 to $323,000. Income of $70,000 to $93,000. Three bedrooms are going to sell for $331,000 to $422,000, and their income range is $96,000 to $121,000. And the four bedrooms are going to sell for $422,000 to $471,000, and the incomes for them are $122,000 to $135,000.
But what about the down payment? The down payment.
And the down payment, yep. So we will be working with the homeowners. These numbers presume a 5% down payment. We do have loan products where people can put down as little as 3%, and several of these income levels actually qualify for HPD's down payment assistance, which gives people money to help pay both not only the down payment, but also the closing costs.
Or if somebody come out with $100 in cash, there.
I'm sorry, Altagracia?
If somebody come with $100 in right there in your hand, and go to make the application another time, and everything full around that same time.
Well, they're going to go through a lottery, aren't they?
It's a lottery.
Yeah.
I'll explain it to Altagracia.
Okay, I say about, but besides the lottery, if when they call the person, if the person got $100 and they put in there. So.
Yeah,
Yeah, well, I'll explain it to her. Let's move on for the sake of time here, please. Okay?
Yeah.
All right, let's go. Come on.
It's hard to do it over the phone. I'm happy to do it in person, Altagracia.
Okay, thank you.
So basically, we came because we're really excited about the fact that there's home ownership opportunities coming to Community Board 2. I think that there are a range of income, so we're excited about that. We are working to close this loan, the construction loan, next fall, winter, before the end of the year. So as early as we can, but we have to, the other two, Community Board 1 and Community Board 3, have sites that are going through ULURP. So, and all of it's getting funded together. So we have to kind of, we're going to tag along with the ULURP parcels. we expect construction to take somewhere between 2 to 2.5 years. We will be doing seminars for home ownership. We say quarterly. We will do them as often. We actually do home ownership seminars weekly in our office. We do them by Zoom, but we will also specifically do them in Community Board 2 and in the Bronx for this project over the duration of the construction period. And then we do expect, given that it's going to be 2 to 2.5 years to build it, that sometime in the spring or summer of 2023 is when we will begin the lottery with HPD, and then we will expect to sell those homes by the end of 2023.
Ismini, thank you so much. Ismini, I know we're in January, but I would like maybe in 2 or 3 months, if you can, come back. You have 700 Menida, the Peninsula, and now these Melrose clusters. Yep. So there's a lot going on at Manny's in our district, and all good stuff, obviously. And it's good that we have a good working relationship. You're very transparent with the board, and I just want to see that continue going. But I think for the sake of time, Paula, we need to move on because we have another big presentation. Okay, and I welcome anyone from Manny to stay on so they can also see this presentation.
Okay. Yeah, I'll reach out for March or April. What do you prefer?
April.
With Paula next month, just to look at the agenda and see what we have on, and definitely. So thank you so much, Ismini.
Well, I want to thank everybody for listening to our presentation, and we will get back with all the answers that we were asked.
No. Okay, I'm sorry.
Thank you.
I see the agenda, so let's go on to the next presentation, Ralph, please. Ralph?
I'll put up the next presentation right now. Actually, they wanted to control it, so I'm allowing them to control it.
I don't think we
so
can,
they can put it
I
up.
don't have the option to share screen. I don't know, John, if you do. It doesn't appear to be an option that I have.
That's fine. I'm putting it up right now and just walking through it, and I'll just say next slide, and I'll move it on.
Cool.
Okay.
That works.
So this is the Radisson Fox Street presentation. You guys are ready? Hi, Ted. Are you guys ready for the Fox Street development presentation?
Yes.
Yes, we are. So first and foremost, good evening. Thank you very much for having us. I know this has been a long time coming. Present this project to the public. It's a project we're really proud of, and I hope you will be too. So my name is Jonathan Butler. I'm the Senior Vice President at Radisson Development. And we wanted to share with you what we're calling the Fox Street development. Located on 1107-1111 Fox Street. We've worked with chair and district manager and the council member quite a bit on this project, and we feel that it adequately meets the needs for Community Board 2, specifically spaces for after-school programs, for community-led organizations to run those programs, need for affordable housing, a good mix of single-family housing for a mix of incomes, and providing formerly homeless services and adequate services within the building. This is an as-of-right project, so it needs no land use action to it, but we are here today because we want to present the project to you so that you're aware of it, and also ask for a letter of support from the community board that would go to the neighboring garden, which we are in
in talks to purchase development rights from. So that garden is the Paradise on Earth Community Garden. I believe we have members from the garden as well, who I'll ask to speak after this. Gary Dearborn is with us, as well as some of our partners on the project, specifically Sharon Smith of Spring Management and Leasing, who I'd also like to speak after this short presentation, and members of my team, Lauren George, and our development partner, Daniel Gabay from G&G Development. So with that, Ralph, if you could take us to the next slide. So we are Radson Development. We may be new to Community Board 2, but we are certainly not new to the South Bronx. We are a developer and general contractor, has over 30 years of experience developing in New York City. Primarily develop 100% affordable housing projects. Some projects that we'd like to highlight to the left of the screen is the MLK Plaza project, which is located just south of this site. It is located on East 143rd Street or East 149th Street. It was a private application rezoning, and it was financed through the city's ELA program. And it was, we're very proud that it picked up multiple awards, including LEED Platinum certification. The next project in the middle is our Linden Terrace 2 project, which just received completion, which we're developing in East New York. And then the project here right is the Crescent Parkview project, which is a bit north of this site, next to St. James Park along Crescent Avenue, which is also entering completion and was developed under the Mix and Match program through HPD. So with that, take it to the next slide, please. So one of the more interesting parts of this project that we really found was the history of the site. And I'm not going to go into great detail on this, as there's certainly members on this call that know the history better than I do. But the site is a former home to the Fort Apache Youth Center, which is a mainstay in the community and was really given the accolades of getting young folks off the street during a turbulent time in the 70s and 80s, and giving them something constructive to do. So George Hankins and some of the other police officers from the local precinct really worked with a group of kids that started out and got them off the street, taught them how to box, and one thing led to another, and then it became a full-service youth center in terms of offering education, dance classes, and a number of amateur boxing fights as well. We'd like to take that to the next level and reestablish the youth center into something that can be that can really focus on the needs of youth in this district today, and something that will be led by the community, either through a master lease or a condo sale. So with that, that's a pretty important part of the project that will occupy the first floor. And then the remaining aspect of the site will be the affordable housing, which we'll talk about in the next slide. So the project consists of 92 units, all of which are affordable. Again, the ground floor will be the youth center. The on-site supportive services that will be able to be eligible for the formerly homeless population, as well as all residents of the building. There will be 24/7 security as well at the base of the building. We will look to see that security has a direct line to the local precinct, so that there'll be a direct line of communication to the local police should there be any problem or services that are needed inside or outside of the building. We are locating a Bronx-based social service provider to provide services that would be located within the offices of the building. So that could be anywhere from job placement services, more technical services, and social services to anyone who may need them. And then, as mentioned at the forefront, Spring Leasing and Management will be considered to be the manager of the building, and I'll allow them to talk a little bit more about themselves and how they see some tenant workshops proceeding in the future to get the community ready for the lease of this building. Next slide. So to take a deeper dive into the proposed affordability, this project is proposed to be financed under the ELA program by HPD. It'll include 30 units of supportive housing, 18 units for families earning up to 30% of AMI, 17 units for families earning up to 50% of AMI, 16 for 70, and then 10 for 80. One important distinction is that 20% of the units are for 3 bedrooms, so 32% overall for 2s and 3s. So as much as it is for single adults, there is a strong true family component for the building as well. Okay, next slide. So this is a rendering of the interior of the youth center as we see it. There will be an atrium above it. We will include a boxing ring as designed in the original youth center. Natural light onto the ring and some of the open area and floor spaces. So I've designed it so that there'll be windows facing onto the garden to the south. So the idea is to make this as an inviting space with as much natural light as possible. Okay, next slide. So this is just an overview of the site plan. As you see, we're building lot line to lot line, north and south, and then have some open space to the west where the playground of the neighboring school is located. You should be ashamed of yourself. All right, next slide. Given the size of the building, we're very conscious of the environmental impact and the shadow studies that would be included into the neighboring area. And what we've determined is that this couldn't be a better site for development given where the shadows go and more importantly, where they don't. Because the garden is on the south side of the property, there's essentially no shadows forecasted onto the garden so that the garden can continue to operate in its full bloom and growing season. And then there'd be a limited shadow impact onto the blacktop of the school to the west. Actually, in the winter time is when there'd be less shadows, and then in the summertime there'd be a corner of the blacktop that would be in shadow, which may be welcome during the heat and sun of the summer months. Next slide. Okay, and then another important distinction about this site and what drew us to it is the possibility of working with the garden, and not a development that would work against the garden, but that we envision mutual gardening programs with the garden so that our residents could be members in a way of the garden and contribute to some of the gardening programs. We want to work with the design. We envision a green wall that would line up the south side of the building, sort of showing gardens sort of easing into the new development so that it's not such a stark contrast. And so with that, I'd also like to remind folks too that we are a general contractor. We've worked with many local groups in the area and will continue to do so. We have been invited to speak to some union members as well. So when the time is right, we'll engage in more formal conversations with them. But given that the project is in the early stages of development, there's not too much we can do in full negotiations for trade contracts. But we are a group that wants to work with the Bronx, not just in the Bronx. And we know some of the players from our previous developments in Mott Haven and elsewhere in the Bronx. So we will be looking to hire locally as well. And then some considerations on the design. We wanted to provide as much open space and interaction with the garden as possible from that south lot line. But we want to ensure that those terraces will be secure. Gates will be at a height that will be above youth and children's neckline, et cetera, so that safety will be of the utmost priority in managing any interaction between tenants and then the garden. So with that, I think my side of the presentation is done. I'd like to give the opportunity for members of Paradise on Earth Community Garden to talk a bit about our interaction and vision for the project site. So I don't know if Gary or Lynn, if you're on, the floor is yours.
This is Lynn Kelly, and I'm also joined by Gary Dearborn and Charlie Reynoso from my team. We have on several occasions, Gary more than me, met with the developers for this project. NYRP has built and managed the community garden there for well over a decade, and we are just as a way of background, a social justice and environmental justice organization that operates community gardens in all 5 boroughs, as well as some major parks in Upper Manhattan, Inwood Park and a portion of Highland Park. So in the case here in Paradise, it's our understanding that in order for the developer to build their development at the density that they are seeking and with the types of uses that they're proposing, that they will need to enter into a discussion or further negotiation with NYRP for the purchase of the transferred development rights from our property to theirs. So as is with all real estate transactions for my organization, we have a real estate committee of our board of directors. As a matter of fact, even our 2 co-chairs of our full-on board are in the real estate industry. And so because we often look at land use and land management, we have a real estate committee that we would be taking any terms of a potential deal to be reviewed by the real estate committee. And then eventually it would require a full board vote in order for us to complete a transaction or even enter in a full contract of sale. So before we even went down that path, it was important to NYRP as an organization that both Councilmember Salamanca and the community board were aware of the need to purchase the development rights and that you were on board with the project. Quite honestly, I wouldn't be able to bring any kind of land use transaction to my board. The first thing they would ask is, what is the community's, is there support? Is the community involved? Have they been made aware? Same thing goes for the council member. So as far as we're concerned, we think that the development could actually bring a lot of eyes on the property, which would be great, and even potentially new garden members. We're always looking for garden members, so even for folks on the call, let us know. If you have interest in it, we'll be back out there in the spring. So that's probably, I guess, the summary from my end. Gary, is there anything that I left out? We're ultimately, we know that there's no formal approval, but ideally, if their community board issues a letter that they're supportive of this project and the elements, that would go a long way in me being able to take this to my board of directors. Gary, anything on your end?
No, I think that covers it, Lynn. I just want to thank everyone and for giving this an opportunity to have it shown to the board. And just to let folks know that the garden was rebuilt in 2018, and it's a public space, and we welcome the opportunity for increased membership.
Absolutely.
Okay, great. That's the plan, and that's what we certainly are set out to do here. So thank you very much, guys.
the percentage of all the vegetables and fruits that are going to be grown in the garden, who would be in charge of that? Who would be eligible to have that? Is it going to be the community or just the tenants, or could someone in the community make purchases? How would that work?
Our gardens work is that there are volunteer garden groups that enter into an agreement with NYRP where and it's a volunteer agreement about number of hours for public hours, maintenance and operations of the site. And as the vegetables are grown in beds, typically those vegetables are donated or distributed or used in the community. They're not for sale. So in some gardens, we would partner with local-based community organizations for distribution. In other cases, it's less organized, but we leave it up to the garden groups themselves as volunteers for distribution.
Okay, thank you so much.
You're welcome.
Before we get into the general Q&A, I'd like to introduce Sharon Smith of Spring Leasing and Management to introduce herself, her company, as well as some of the strategies and approaches we would take for lease up and management of this building.
Pleasure to be here with you. Can you hear me? Can you hear me? Okay.
There's some background noise. I'm just going to mute everyone else. I apologize for that, Miss Sharon, so you can continue.
That's fine. I'm actually here having an allergy moment, so hopefully I won't consume myself with coughing. But Spring Leasing and Management, I am the principal of this company. We were formed in 2019 as a minority woman-owned business enterprise. It's the combination of over, maybe 30 years in affordable housing in New York City. I cut my teeth with Related Management of New York with Jeff Brodsky and Big Wine many, many years ago, pretty much right out of college, after I had done a stint with the New York City Food Bank. And from there, I went on to work for Douglas Elliman, and then for Atlantic Development Group with Peter Fine, who built thousands of units within New York City in affordable housing, a lot of them right next door to this proposed project. I had probably about 2,000 units in the South Bronx while I was there between the years of 2005 and 2000, and I guess that was about 2010. And then from there, I went on to work as the president of Progressive Management of New York under the Arthur Companies, who are also very, huge in the affordable housing space in New York City. And as a result of doing all of this over these many years, I thought it would be great to launch a woman-owned company, doing what I've been doing all these years in a more intimate and more hands-on environment. So Spring was launched about a year ago, and we currently have about 600 units in the Bronx, very close to where this project is right now. They're affordable deals. They're mix and match with supportive housing, with homeless families, and AMIs up to 130%. So we also have another deal that's coming on board, also in the area of Morris Court, which is over 200 units for another developer. So we will have a lot of bandwidth, particularly in this neighborhood, once the project is completed, that will allow us to service this building, I think, to the degree that we want it serviced. In terms of marketing, I think is one of the big questions that Jonathan mentioned to me that may be of interest to the board and the public. We are very engaged with the community when we do our marketing. We are open to hosting info sessions where people can come and get information about the process, the HBC HPD marketing qualification process, which sometimes is a mystery to households that don't understand what is required, what the documentation is needed, how credit is viewed. How is landlord history viewed? And so we find it's very, important and helpful if we can provide that information up front, pre-lottery, so that people can actually get, a better understanding of what the actual process is. So we will be more than happy and willing to do that for this project as well, once we've gotten to the point where we're doing marketing, something we've done in the past. I marketed probably in my tenure, probably close to 10,000 units of housing within New York City, tax credit projects, Section 8 projects, also, what's the word I'm looking for? Market rate projects. So even though the company is new, I am very, very comfortable in this space and, feel very excited to be a part of this particular development. I don't have any questions, but that's who we are.
Okay, so this is Paula Fields-Conyers, the chair of the Housing Committee, Ms. Sharon. You said you would be willing to do this. Will you be doing the seminars, or will the development be doing the seminars and that we talk about, which developers do in our district when they bring development to the district, which will be a one-part series of HPD and how it works. The second part would be putting people onto Housing and Connect, and the third portion would be advising people on how to increase and learn about credit and how important it is for housing?
Well, we can be a part of all aspects of that program. We can do it from soup to nuts. We certainly have done countless lotteries throughout our years. The team that I have on board with me has been with me for probably about 10 years, performing lotteries and doing outreach. So we can certainly, work with you to craft a program that would address, some of the most, critical issues or concerns or just roadblocks that people face as they attempt to engage with the lottery program and process.
Okay. Thank you.
Very well.
Paula, before you go any further, I need to correct the statement that was made by the presenters where they said that Community Board 2 was on board. I, with you, met with these individuals on a Zoom with Ralph, and I wanted clear that we said it sounded like a good project, but as always, it had to come before the committee and it had to go to the full board for full approval. I don't want it to be misconstrued out there that we are doing things without board approval.
Okay, thank you, Bobby.
Questions? Chairman Crespo, you don't got no question?
Yeah, who's gonna, your subcontractors, I would assume you're gonna try and get them locally and they don't come from New Jersey, Long Island, or any parts unknown?
And that's traditionally what we've done. It's what we've done on our most recent projects in the Bronx. This site lends itself to the opportunity that there are many groups out there that for specific trades that are locally sourced. So we feel confident that we'll be able to hit some strong local hiring targets.
And out of the 92 units that we're talking about, 50% are still being for community board?
That's right. That's our commitment, and we'd like to exceed that. That over half the units will be leased up to members of Community Board 2.
All right. And when we had the discussion, I believe that there was supposed to have been some discussions with yourselves and some of the local organizations, and particularly Urban Health, because of the Dr. Izquierdo name that you wanted to use for the Center. How's that going?
Well, it's going well. This is part of our public review process and public and community engagement process. So we've spoken to Paloma Hernandez of Urban Health Plan a number of times. We'd like to honor legacy in some way, as there's a lot of history to this site. We understand it's a consideration her family make. So the plan on any sort of honor to her father is in her hands. We welcome her decision.
All right. So I believe when we spoke the last time, I stated that, Dr. Izquierdo has a big name in this community. May he rest in peace. The Izquierdo family name has a long history with this community. And we, I think that I stressed it the last time we spoke, that we would like strongly, we urged it strongly, that discussion be held and possible. I am a Dr. Izquierdo fan. I have no qualms in stating it. I don't push for it, but I am stating that I do have some concerns about it, because if you're going to name a sports complex, it should be after somebody that has been part of this community. He was one of the original community board members of Board 2. And so he opened up the San Juan Health Center, and from there it moved on to being what it is now as to the urban health. And I think that, it's a great honor to have I believe it would be a great honor, and it would bring a lot of respect to the project. I know with my board members, it would bring a lot of respect. So I would hope that we would get something soon. I know you want this letter, but there'll be some stipulations, and I think that, before I put the stipulations on the letters, I would like to hear from Paloma Hernandez before I do it, because I want to make sure that everything's okay on that side.
Absolutely. Couldn't agree more. The project needs to be worthy of Dr. Izquierdo's name. And we hope we're getting to that point with all it intends to accomplish. So it's a decision that Paloma Hernandez and her family need to make, and we welcome that decision.
All right, and I believe you had mentioned that Spring was going to do the rent up on this building.
Spring doing the lease up, correct? And we just went over the strategy to do training, workshops, and specifically for tenants who may need or potential tenants who may need help with the credit applications. That's correct.
I think that I said I would like for Ralph to have some of the resumes of these companies, because we don't particularly know them very well. The management that Ms. Smith's company, I'd like to know what addresses you have surrounding this particular project, so like that maybe we can walk around and see the kind of management that this company's Radson's planning to bring on.
Absolutely. We'll be happy to provide you with our resumes of our executives, and also we can share with you our addresses of the current portfolio.
Make it available to the district manager, Mr. Acevedo. And the only other thing that I have, which is always my thing, and you already said it, the security is going to be hooked up to the 4-1 in case of emergencies and stuff like that, right?
Yeah, I mean, we're not at that point where we can fully commit to that, just given the fact that we're deep in
I understand that, but that's
security company on board and talk to the precinct. But that type of strategy, after we spoke about it, I researched it, it's something that has definitely been done before. Given the history of this site and its connection to the local precinct, I doubt we'll have any complications in getting that implemented.
Okay, thank you. Thank you, Ralph.
Is that location governed by the 41st precinct or is it the 42nd?
4-1.
Okay, thank you. That's it for your presentation, guys. That covers
I have no more materials to present. At this time, it's just Q&A.
Okay, so no more questions.
Yeah, I just want to comment, Paula, really fast. I just want to say that John and his group, Laura in particular, they've been very accessible and they've been on top of this. I know that the council members here, and I don't know if the council member wants to have any input, or if he has any concerns or questions regarding this project. I think we should afford the time to him.
Yeah, thank you, Ralph. I'm on this call because I wanted to, see what was the response back from the community on this project. And I'm extremely excited and happy that we're going to be able to bring back a youth center.
Rec center, yeah.
I'm sorry, Aiden, stop. Okay, to the community. What's even more exciting is that we have a rec center, right? We have the Hunts Point Rec Center and we have the PAL, which is run by the city. But this is an opportunity where we can run our own youth empowerment center, in our communities, working with the developers, picking the right organization, and ensuring that the needs of our communities are met. I'm so invested in this project that I allocated Resaway money in the last budget for this project. Correct me if I'm wrong, John.
Thank you.
I'm excited. However, I also reminded the developers and the garden that they needed to come to the community board and they needed to take the recommendations of the community board serious to continue to have my support. And I see that that's happening. So I just want to commend you guys and I want to thank you.
Thank you.
And I'd like to...
Officer Sokola has her hand raised. So Officer Sokola.
Happy New Year. Hi. So, super excited, especially after hearing the history of the Fort Apache gym. And I know Salamanca mentioned it 2 years ago during our street renaming back in February 14 of 2019. So I want to know how would, the precinct and the officer, especially that we have a NYPD boxing club, could get involved in regards. And I know I'm thinking way ahead right now.
Yeah, no, and thank you for doing so. So, the aspect of doing the site assemblage has really been taken with a labor of love from our partner, Daniel, who's on the call. I think it was a accumulation of 3.5 years of working with the remaining members of Fort Apache Youth Center, getting them re-engaged really at the site, and then moving on to a vision of sort of recreating the youth center and really establishing a sense of trust that this youth center could run, obviously without them because they are aging, but run in a way that they would have run it or wish to have run it, and honoring their wishes and their legacy to the future. So we've talked a lot about different ways we can run it. One vision we had was bringing in more, not only just male instructors but female instructors, to make it a very an inviting place to all different sexes. A lot of focus on the empowerment side, et cetera. So we're welcoming any sort of police leagues that be involved. I think now more than ever, a community level connection between the NYPD and community members, especially youth, is sorely needed, and something we all can benefit from. We are, in the early stages of forming this, and this will be a community-led youth center. So it's not something I or any of my partners will sort of invoke and in really charge in terms of how it's run. But we do welcome that. I think it's a great idea. And I'll also leave it to Daniel, who worked with the remaining members of the youth center, to chime in as well on that.
So thank you very much for having me. My name is Daniel Gabay. I worked for one of the companies Shannon's previously associated with, so I'm very pleased to see her involved in this, because I could tell you she does a beautiful job with the residents and with the properties. This endeavor began some 4.5 years ago, where I was literally knocking on doors with some of the aged board members, and I'm not going to lie, I was chased out of more than one front yard. Just because this had been dormant for quite a long time. Fort Apache itself was in terrible shape, and when I understood the context of what I had acquired at a foreclosure auction for one of the parcels, I was moved to try and reestablish some of the glory of these officers that put themselves and their money and their time literally as seeds in the community. And I think this coming together is simply just to pay tribute to what they've done, but also to really take a gem and allow it to serve the community from now to the distant future.
Clarabelle,
Yes, sir.
As long as the captain does not challenge me to 3 rounds, we got it made.
Listen, I get excited working with the community board all the time, but when when Councilman Salamanca mentioned the Fort Apache gym, I was super excited and decided to do my own history, and then realized that it was founded by 2 officers named George. So,
right, George Patterson and Butler.
Yeah.
Which is, reading the history now, and I think I believe I shared it in the chat right now, and I sent the story to Cynthia via text. It's more personal now because my papa, who passed away, his name was also George. So I was like super, super excited just listening to all of this. So I was like, okay, let's see how we can move forward and be positive. And I know that a lot of officers will be super excited having a boxing and getting involved, especially with the history of the gym and then the history of the community. And I'm so looking forward for this hopefully future youth center to take place. I know it's going to take a while, hopefully before I retire, but looking forward to it.
I am as well, because I was a former recipient of the original one on Fox Street with Butler in the beginning of his in the prime of his career. So I'm super excited, and it's something that community board has been really fighting for, recreation centers, so that we can try to engage the youth into doing more positive things. So that is a wonderful thing. I appreciate you guys coming to the community board and informing us, because as you did say, it is as a right, and you really didn't have to, but the fact that you did is very, very important and very special for me.
Paula, can I say something?
Sure, Luis.
Yes, hi. My name is Luis Marrero, and I do work at Urban Health Plan. And Paloma was part of the phone call, but she had to go because she had another phone call, so she couldn't be here. But I just want to confirm to Bobby that, yes, there's been conversation with Paloma and Urban Health Plan about the project. Okay. There is also conversation about the involvement of Urban Health in the community, in the youth center. Okay. So there's conversation happening, and we're looking forward to keep having those conversations. I just want to make the point.
Thank you, Louis.
Hi, Louis.
I'll put Louis against the captain.
Okay, so they need a letter of support. So
no, they don't need a letter of support, but the park was asking if there was, they just, I guess, want to know what the board's, if the board is supporting, what's the board's position, more or less. But this is as of right project. That they're attempting to be good neighbors, just letting us know what's going on here. But there's also conversations with the park, and because it is a private park, and the park I just wanted to know the sentiment of the board, and what position the board was going to take. That's mainly it. I don't know if there's anything else. I would really want to ask John and Lauren going forward to just keeping the board informed.
Mm-hmm.
As you saw the presentation before you guys, that's a huge project for us, La Peninsula. We're talking over 700 units, 5 buildings, and you can see the amount of work and transparency that the development team is keeping with the community board. And we just ask if there's something, similar along with you guys. I think it just creates greater transparency, and it'll be a good example of being a good neighbor with a community board, and it's something that the board is looking forward to, as you can hear also.
It was good to see that example of kind of what you're looking for. So I think, as Gary and Lynn said, that while the project doesn't need a support letter per se, it would be good to have something in writing that they can share with their board, just to kind of show that we did this and that we sought input and the general sentiment from the board.
So Ralph, I believe that the committee.
Do we have? Hold on. 1, 2, 3, 4, 5, 6. I know everyone but Paul Martinez was on at one point. I'm hoping that Altagracia Joyce is still here. I see Guadalupe is still here, and Jeffrey was on. Jeffrey is still on. So we have 1, 2. We have 5 out of the 6 board members at one point. I don't know if Joyce is still on and Altagracia.
Okay.
Altagracia looks like she's not on anymore. But
so here's the thing. Out of those 5 board members or committee members, do they have any objections in forwarding this recommendation to the full board?
Objection at all. I actually support the letter.
So we got to just we don't need the exact wording of the letter, but the motion, we need to be clear on what the motion is, So we're writing a letter to who, and what is it that we're saying? John, can you help us out a little here?
Yeah, I'll do my best. I think we still have Burn on from the garden, so maybe he can be precise. But we need a letter supporting, or a letter that the community board is aware of and supports the project in its current form. And then Gary, I don't know if there's any other details you want to provide as well.
Yes, I think that's pretty much what I need. And what the reason we need it is to demonstrate to our board of trustees that due diligence has been done, that back and forth dialogue is happening and will continue to happen. And at this stage, as Jonathan said, the board is supportive of the project moving forward, knowing that there will be further follow-up.
May I say something? I think because of the sensitivity of this project, and because it's not is an as of right project, I think that the board, it's up to you, but I recommend that the letter be very specific as to what you are approving, which was what was presented today, which is, I believe, is 90 units. I would on the letter dictate, right, how many units, 90 units, the AMIs, and how many 2- and 3-bedroom units, just so you have that structure. And I will also recommend that you include the community, the youth center, as part of that. So you always have that as a basis as to what you originally approved from the very beginning.
Thank you.
Most definitely. And I think that Ralph Acevedo, I think you could work with the developer in putting that whole thing together as part of the councilman's suggestion.
Fine. I'll get working on that. The full board meets on the 27th, so it has to pass. We just need a motion now, Paula. The motion will say that we're writing a letter, but who are we writing the letter to? So Gary or John?
To the developer.
To Gary.
To the developer, sir.
You're writing it to the developer, so we're writing it to Ratzlin, and just in support of exactly, in particular, I'm going to bring back up this page here.
Just a description. That's what I was going to say.
Right here. This is what we're going to.
That's what we're going to mimic in the letter.
But also, Ralph, take into account what the suggestions that the councilman gave, which was the AMIs on it, which is it's already in another sheet that you got on here. Right, that sheet. And to make sure that the gym, you know, is stated that it goes to a community group. And you know, I personally would feel comfortable if we put Urban Health as one of the groups to talk to about this.
The motion is to write a letter to the Ransom Development in support of what we're calling now the 1105 Park Street development, because I don't know if there's an actual name. I don't know if they're going to stay with Fort Apache, and that the letter of support is basically for to propose what they actually proposed here today, which is to keep it in the 4 brackets of these AMIs.
Right.
And the units, the Empowerment Center, and also the letter is going to also state that they will assist in creating a workshop for the Housing Connect, as Ms. Sharon Smith has stated. That's basically it. And that will be the letter that we'll send to the developers. The developers then can turn around and send it to Gary, but that will all take place if it passes on the full board on the 27th.
Okay. Okay, sounds great.
Write the letter to Ransom Development in support of the project that was presented today, along with setting up a workshop for the Housing Connect, because that's not indicated on their proposal.
Our committee that we have with the Housing Connect.
So the motion is as that we're going to be supporting the project with the AMIs and the proposed units and the workshop, right? So I would like to make the motion for approval. So is everyone there?
Alexandra.
My committee members, we need a vote on this.
Yes, I make the motion to approve the letter as indicated by Ralph, Crespo, and Salamanca.
Who else we got on here? I can't.
Jeff is there. Jeffrey's there.
Jeff?
Jeffrey, we need your...
Jeff, would you second this motion?
He's on mute.
He's on mute.
Yourself.
Ralph, can you unmute him?
Wes, he was here. I know he said he was making dinner, and that was at 5 o'clock. It's now 8 o'clock. So I don't know if Joyce is...
He's still here, Ralph. He's still here. But he's just muted. I think he could...
Yeah, I know.
Okay.
All right.
See who else you got here?
Yeah.
3 of them now, because I don't see Altagracia or Joyce.
Yeah. Who's that?
Right. Jeffrey?
Jeff. Do you second this motion?
Because it was he's in here too. There you go.
I second it.
Okay, thank you, Jeff. So we're going to so Paula, since it was already general consensus of the committee and that you do not have quorum at the executive committee, make mention and then I'll make sure that we'll follow procedures and protocol to get the executive board approval.
Okay.
Executive committee approval, and then we'll take it to the board 2 days later.
Okay. Okay, is that good for you guys at the development, the Radisson Group?
Thank you. We really appreciate your time.
Thank you all very much.
Oh, I have the wrong agenda up also.
I
have the wrong address for their project. It's 1105 Fox Street. I'm sorry. We did create a new agenda.
We can, myself and Lauren, we can provide all the information support as well for the letter.
Yeah. Yeah, and I just want to reiterate, John, that having working with Lauren has been good. She's very, very transparent and very accessible with this stuff. So if there were any concerns, I brought it up to Chairman Crespo and to Chairwoman Field Conyers, and everything has been working well with Lauren. So thank you so much for that.
Great to hear. Thank you.
Good night. Take care.
Good night. Okay, guys,
Hooray.
new business.
Fingers crossed. Sorry, I had to say that. Okay, bye.
Is there any new business?
Thanks.
Is there any old business? No old business, no. Any announcements? Okay, so I would like to motion that this meeting be adjourned.
Motion.
Thank you. Thank you,
Good
guys.
night, everyone.
Good night.
Good night, Gladys.
Good night, gentlemen.